to the June 22nd, 2020 meeting of the Durham County Board of Commissioners. I will now share the public charge. The Board of Commissioners asks its members and citizens to conduct themselves in a respectful, courteous manner, both with the Board and fellow citizens. At any time, should any member of the Board or any citizen fail to observe this public charge, the Chair will ask the offending person to leave the meeting until that individual regains personal control. Should decorum fail to be restored, the Chair will recess the meeting until such time that a genuine commitment to the public charge is observed. As a courtesy to others, please turn off your cell phones or mute your phones during the meeting, and we will start with the Pledge of Allegiance. And of course, I would love everyone to join in, if possible. I pledge allegiance to the flag
of the
United States of America,
States of America, and to the
republic which it stands, one nation,
under God,
indivisible,
liberty and justice for all.
Justice for all. And let's see, are there any agenda adjustments this evening? I think you captured everything, Monica, didn't you, in our updated agenda?
Madam Chair, just want to mention the June 10th conversation just quickly. If we can just add that, just a quick conversation around that.
Okay, that would be great. So let's see, should we add that? Well, we can just add it as one of our first discussion items. You want to do that?
Sure.
Okay, so we'll add that for a quick. We do have a very packed agenda tonight. I'm going to work really hard at us not having to have another meeting this week. So, okay. Announcements. Summer Meals Program. Durham Public Schools School Nutrition Summer Meals Program for children begins now through July 31st. All children in Durham County up to age 18 are eligible. Please visit www.durhamcounty.org for more information. Know where to get tested. Do you need COVID testing? There are 3 easy ways to find a testing location near you. You can visit the website for a list, which is at the Durham County Public Health website. You can visit our data hub, which is www.durhampublichealth/durhamnc.rcgis.com. You can also go to the state testing portal and enter your address, which is at covid-19.ncdhhs.gov/about-testing/find-my-testing-place. But anyway, we will have this information on our website and in our announcements. Check out.
Chair, in that regard, it might be good to shorten the announcements.
Yeah, I won't read all the websites.
Yeah.
Okay, check out our Durham State of the County Health Annual Report. This report is an update from the 2017 report, and it has the county's top 5 health priorities: affordable housing, access to health care and health insurance, poverty, mental health and obesity, diabetes, and food access. You can find that at healthydurham.org. Emergency COVID-19 relief. Central Piedmont Community Action, Inc. will be assisting low-income individuals and families who have been impacted by COVID-19 to help get them back on their feet. Assistance will be provided to 500 participants in Chatham, Durham, Orange, and Randolph counties with income levels at or below 200% of the federal poverty guidelines. For additional assistance, please call 919-742-2277. Again, this is Central Piedmont Community Action, and this is our local provider for these CDBG funds to help Durham residents. Library takeout. Place your to-go order now. Durham County Library is now accepting hold requests for pickups. For hours and more information, please visit the Durham County website. I know people are excited about this. Family Summer Learning with Explore Durham 2020. Each Monday, new content will be published to celebrate history, literature, arts, math, and science activities and learning opportunities in and around Durham. And for more information, please visit Explore Durham 2020. Victory Garden Program receives grant to expand. So Cooperative Extension has a grant for Durham residents to create gardens. There are gardening kits for Durham families and containers. There's a $20 cost for each kit. Scholarships are available. And the distribution starts tomorrow, June 23rd. You can go to the Durham Cooperative Extension website for more information, and also about virtual 4-H summer camps for children in Durham. Also, please visit the Cooperative Extension website to find out more about these camps. Any other information about resources for our community? Okay, lots of great announcements there for our community. Okay, we have our minutes from the regular session April 27th and also regular session May 11th, 2020. What is the pleasure of the board in relation to our minutes?
Move approval.
Second.
Okay, moved by Commissioner Hill, seconded by Commissioner Reckow. We will take a voice vote, starting with Commissioner Howerton. Commissioner Howerton? Okay, why don't we give her a minute, and we'll start at the other end. Commissioner Carter?
Yes.
Commissioner Hill?
Yes.
Commissioner Reckow?
Yes.
Commissioner Howerton? Okay, she looks frozen on the image.
I'm actually calling her right now.
Okay. She might want to call in separately, which is what I've done.
She is actually about to call in, but so that we can move forward, she did give an okay for the minutes.
Okay, great. All right, and I'm a yes, so minutes unanimously approved. Okay, we have a number of consent agenda items, and I know that a lot of commissioners worked really hard getting in their questions and comments ahead of time. So I would just ask, are there any items that commissioners would still like to just poll for any further questions or discussion at this time?
Madam Chair, I would -0275.
Okay, can you just identify?
And I'd actually like that. That's the one related to the architect for the firing range project.
Okay. And any other items that commissioners would like to poll for further questions or discussion?
Madam Chair?
Yes.
I would like to pull the 0273, the item about the approval of the contract with WellPath.
Okay. And I would like to just get a little clarification on 20-0272 about the DSS contract with DFI.
Okay, well, so where are we? I don't know, my system just froze up.
We are just looking at the consent agenda to see if there, even though we did get in a lot of questions, are there any any things that people still would like to pull for further discussion or questions?
I had some questions about the tax report. Just for clarification, if we could pull that one. And I didn't get an opportunity to talk about, to mention the Juneteenth conversation.
Right, we're going to put that as the first item after the consent agenda.
Okay, cool.
Okay.
I think it was that one. Yeah, that was the only one, but now I won't be able to see it when he pulls it up if I don't get my system up.
Okay, well, let's start with, okay, so you wanted to do the refunds and releases item, Commissioner Howerton?
There was a chart there that I had some questions about for clarification. I can't get this thing to work.
Was it about the needing additional funding for the health plan?
No, it was the chart that we have that I wanted him to, staff to explain. There were some things there that I didn't quite understand. And I wanted him to go over the chart, but I can't get my system to open up.
Was it 20-0271, that item?
Yes.
Okay. Property tax releases and refunds for May 2020.
Why don't we just pull that one, and I'll keep trying to get the system to open up, and we can go back to it.
We'll come back to that. Okay, so 20-0272, I really appreciated, Marcia, all of your feedback, and I just wanted to clarify one thing, was just, I just wanted to be clear that a lot of the things that I raised, I guess what I would ask is if you could just send us a revised draft of that agreement so we could see it with the revisions, and, you know, and just everybody just give an okay on that, a revised version of that scope of work, okay?
Yes, I'm happy to.
Okay, that's great. So, you know, we're going to approve it, but with the understanding that you'll get out a revised scope of work and make sure commissioners can just review that one more time.
Understood.
Okay, great. All right. And, all right, next item is the WellPath contract. Commissioner Carter.
Yes, I also want to thank Rod for providing information over the weekend to some of my questions. So my original concerns are related to the fact that the state prison system has been ordered to develop a plan to address the substantial risk that detainees might be in by virtue of the congregate living conditions in prisons. And part of their plan involves universal testing. And I'm just wondering if this contract with WellPath includes funding for that amount of testing and any,
Commissioner Carter?
To minimize. Yes?
Okay, go ahead.
Can you hear me?
Out a minute, but go ahead.
Okay. So my main question is, does this contract include funding for universal testing or movement towards that to bring us in alignment with what the state is going to be doing in the prison system to minimize the risk of this, of, you know, the spread of COVID and risk of death, risk of long-lasting health consequences stemming from the disease? Just wondering what in this contract might be related to COVID and preventing the spread in our jail.
Good evening, Commissioners. Can you hear me?
Yep, we can hear you, Rod.
Commissioner Carter and fellow commissioners, we say good evening to you. And through my research, in order to answer your question, the answer at present is no. The current contract as presented does not include that information. However, I will say that throughout this entire COVID experience, I've had an excellent working relationship with Sheriff Burkhead, and we have been successful in meeting a number of different challenges as it relates to that. As such, I dare not speak for his jail. For the most part, I will say that should it be his desire to do such, Public Health stands ready to assist in any way we can. But to definitively answer your question, Commissioner Carter, at present, the contract does not spell out any information as it relates to COVID, and I'll be happy to take additional questions.
Rod, do we know whether or not we're providing masks for detainees in the county jail?
I believe that would be a question that Sheriff Burkhead, if he's on the line, I'm pretty sure he'll be able to answer that for you, Commissioner Carter.
Yeah, I know this is only sort of tangentially related to this item, but I don't know when we would have an opportunity to, you know, to really raise this concern that the state Superior Court judge in Wake County has ruled that universal testing must be conducted in their prisons. I don't know, you know, do we think the living conditions in the county jail are so much better that we don't need to do that here? It's just I just have a very strong concern about this and feel like we need to be doing everything we can medically to prevent an outbreak and a spread. And if we're not doing the universal testing, I just don't know that we're doing everything we can. I'm worried about it.
Madam
Indeed,
Chair.
Commissioner Carter. I'm sorry, go ahead. I'm sorry, Commissioner Rackall, you can go ahead.
Well, I just want to thank Commissioner Carter for bringing this up. I would like to piggyback on it and ask Rod, I know that this is a cooperative effort, public health providing or helping to contract for the medical services, but the sheriff running the jail. However, as I feel as though at this point, clearly some very good things have happened to date in the sense that none of our prisoners that I'm aware of have contracted COVID, and that's wonderful. But we've got to keep that track record up. We can't let down our guard. We've got to focus on having them be healthy. And I'd be curious in terms of best practice in jails around the country. Obviously, in a jail, people get booked in, perhaps often on a daily basis. And as a new person comes in, there's always a risk that they're carrying COVID. I don't know whether we could set up a system of screening such that any new detainees are tested and quarantined until the test results come back, and also begin to systematically test the prisoners who are in the jail. So it would be interesting to have that looked at as to feasibility and cost and bring us back some information about it at a later date. if other commissioners agree it's a good idea.
Yeah, I just wanted to make sure we heard from the sheriff and let him get a chance to explain, first of all, what is happening and what WellPath is doing right now, so we can get a sense of that. So, Sheriff Burkhead.
Good evening, everyone. The only new question that has been raised is whether or not we can do universal testing as part of our contract renewal. So I won't spend a whole lot of time addressing what we've been doing for the past 101 days as it relates to mask, quarantine, isolation when necessary, working closely with public health, following the CDC guidelines, the American Correctional Association guidelines, following DHHS guidelines. So all of those questions have been answered in previous meetings and documents. I am all in favor of increased testing, universal testing, but it's going to cost. And we don't have the money currently in our budget. And to your point about prison systems being better or worse than a county jail, they're two different animals. We really can't compare the two. The governor allocated funds for DPS to do that testing, but in our facility with our population being what it is, we're able to do far more than they are doing at the state level. Everyone is screened when they come in. Everyone is isolated quarantined, for 14 days before they're put into general population. Temperatures are checked. WellPath does a fantastic job checking on them on a regular basis. Should someone exhibit symptoms, they're transported to Duke. So we've done a fantastic job. The staff at the detention has, as I've said before, nothing short of a miracle that we are where we are today with 0 cases. Let me say it again, 0 cases. If anyone doesn't understand, with 0 cases in the detention center.
All right, well,
and that's
what to keep it that way. And I also, just to move things along because of our agenda, I would say I support this. I'm assuming that our whole board really does support this. I know everybody cares about this issue that Commissioner Carter has raised. So if we could ask our staff, Rob, the sheriff, I know whoever is involved with the contract, and also just in relation to what other resources that we do have locally, testing with Duke, Walgreens, CVS, what are some different options that we have to implement a regular protocol for regular testing in the detention center, and if that can be brought to our board, if possible, at the if it would be ready at our July 13th meeting, that would be great to bring back what some options are for us to consider, or if not, as soon as possible. Does everybody, board members, does that sound good as a pathway forward?
Madam Chair,
Yes.
Just in reference to WellPath and the contract, I've served on the Board of Health for a number of years, and what I know about that contract is to break that contract, it would cost us a lot of money right now, because we always had to bid that contract out to a lot of different companies, and right now it's not up for renewal. So if we start to go down that path to want to break that contract, it's going to cost us money.
Okay, thank you. And I do want to acknowledge we have gotten a lot of emails today from residents really concerned about WellPath and the contract. And I know that before Gail Harris left, I was involved in a lot of conversations with residents and with her, talking about what has happened in the past. And unfortunately, actually in the past, when the county, had their own contract, we did not have a good track record. And we've actually had a better health outcomes with WellPath, than we did before. I know she really, was with the county for what, almost, 50
40 years.
40 years, but we had, that had been a topic for discussion, very recently. And, as Commissioner Howard said, we did put this contract out for rebid, and, WellPath actually rated better than the other companies that had bid on the contract. So it's a complicated issue, and I know that there have been issues with WellPath and other locations, absolutely. But we, knock wood, I think have been fortunate here in Durham County. But I just want to acknowledge that we have heard you, and we understand the concerns that people have in the community. Anything else before we move on? Commissioner Carter, does that address the issue that you raised?
I do want to say I think Sheriff Burkhead's right. He's been working miracles by having 0 cases of COVID. That is indeed a miracle. I just hope we can continue to have that miraculous outcome, and I'm not sure we can without more testing. So I'd say we really need to know what it will cost to do everything that he believes we need to do. If he doesn't think we need to do it, you know, I'm willing to listen to that. But if the sheriff thinks we need to do it, I don't want, you know, an outbreak to be on the backs of commissioners who didn't provide resources to make it happen.
Right, absolutely. And I think we heard the sheriff said that he would welcome that. So that's what I heard. But that he needs the resources for it. So so again, we're asking staff to bring this back to us as soon as possible, what our options are to implement this protocol for regular testing in the Durham County Jail. Okay, let's see. The next item that had been pulled was 20-0275 about the architectural services related to the firing range. Commissioner Reckow.
Thank you. There's a lot of musical chairs going on. There's another agenda item tonight, the Bulls initiative, that talks about potentially decommissioning the biotech, biosciences curriculum and labs up at the Northern Durham campus of Durham Tech, and moving that to a more central location, also expanding it. And as I was thinking about that and the fact that we already have a public safety presence at the Northern Durham campus, we have classrooms where the police are trained. This other section, the biotech section, could be repurposed for classrooms for our sheriff. And I talked to Bill Ingram today, and he said they don't have any logical curriculum that they would necessarily put in North Durham if biotech were to leave. So I just thought we should perhaps take a deep breath and just assess where we are, given that this is a facility that's relatively new, and we built it for instructional purposes. It does exist, and I'd hate to have it sitting fallow if we move in the direction that the Bulls initiative would cause us to move.
So I guess it would be good to hear how much of this contract relates to the classrooms, and also, Sheriff, if you could explain, I don't know where the firing range is located. Could there be classes at Durham Tech and then going out to the firing range? How does that all work?
Sheriff, if you want to take the first part, this is Perry Manns, Deputy Director for County Engineering. Commissioners, the first part of the question is how much of this design contracts does the classrooms encompass? The short answer is not much at all. This contract is actually for pre-design and for project analysis as well as programming to determine what's needed or what we can accomplish out at the firing range. I remind you that the biggest portion of this contract is to address the drainage issues out at the firing range. That's the biggest part, is to address the topographic challenges, the target system, the reveals, and just what's necessary for that. There's also a small maintenance, sort of like workshop, garage, storage location, paying the grounds, up at this site. Again, this is a pre-design contract basically, and the intent was once we sort of determine what the actual scope of work is, we would then have to come back to the board for continuation on an amendment for the actual design contract. As far as the classrooms, I will have to refer to the sheriff's office on that to see if this is something that they can, accomplish at an off-site location.
Thank you, Perry. Trying to unmute, but he's absolutely correct. Only a small portion of the design is for classrooms. It's just not very conducive to go to the range and not be able to teach the class on site and then immediately go out and apply the skills and evaluate the skills. Because what we do now is teach in one area at the North Station and then have to transition over to the range. So it's not right around the corner, so it's just not a good setup. So it would certainly increase our efficiency and being able to have it all right there at the range. And certainly we want to get the drainage issues corrected as well. But it would just, can we accommodate it by what we've been doing? I mean, obviously so, but it's just not a good way for us to continue to move forward. And I do have other staff on the line if you have other questions. David LeVar can speak to the historical nature of this conversation.
Good evening, Commissioners. This is David. Just wanted to piggyback on what Sheriff Burkhead previously said. So right now, about 33% of our blocks of instruction are taught off-site. That off-site meaning that our current training facility cannot provide the space that's required. Also, the landscape doesn't fit our needs as well. So what we have to do is go out and partner with churches and schools for gymnasiums and stuff like that to provide this blocks of instructions. One of the other things that we found is fundamental is we try to teach and then we apply, and then we'll go to the next section and then we'll teach and then we'll apply, and then we'll teach and apply, and so on and so forth. The challenge that we have now, some of these blocks of instructions are 2 weeks long, and we'll teach the entire lecture and then we'll go out and do the practical applications. And the challenges with that is that students don't have the availability to ask questions and learn in an environment that's conducive to learn. We've got one building out there that we have to roll lawnmowers, remove weed eaters, remove gas cans. It doesn't have air, barely has any heat, just a little space heater. And then all the other reasons why we need these upgrades. We have one porta-john that is shared all year round by both male and female. So there's a lot of challenges with that. And it's not just for firearms training. As mentioned earlier, we've got a lot of blocks of instruction where we need classrooms with relevant size and lighting to make sure that we fit within the Justice Academy guidelines to administer these blocks. I'm happy to answer any other specific questions as it relates to the upgrades themselves.
Thank you, David, and Sheriff Burkett for that information. I don't know, Commissioner Reckout, maybe that what you're thinking about for the Northern Durham Tech Campus may be more relevant even to thinking about the public safety complex in the future and how the Northern Durham Tech Campus may be able to help with that and using that facility for more of those classes. So I understand what you're trying to get at.
Well, it has always been, I think it's been frustrating that we, the county, funded the Northern Durham campus. We actually also help fund the maintenance of that campus, but the campus is used by the Durham Police Department for its courses, not by the sheriff. So with this opening, I do think there's an opportunity. There's going to be freed up space. Obviously, it would need some upfit or a little bit of renovation to change its function a little bit, but it's good new space that could be used by the sheriff. That's why I was bringing it up.
Well, thank you for raising that. Okay, so want to move on to back to Commissioner Howerton. Were you able to pull up what you have been asking about related to the tax relief and refunds?
Yes, I did. I found it. There's a chart that shows the refunds, and if we could just clarify what are the codes? You just clarify what the codes, the difference in the codes for me.
Mr. Howerton, are you referring to the releases and refunds for May 2020, the totals document?
Yes, and there's a 300, there's 360, 305.
Right. Right. Those are our district codes. So in this report, 300 is the county district, 360 is the city of Durham, 340 and 400 are both fire districts, and then 305 is the capital financing district.
Okay. Okay, it wasn't clear on there what that meant. All right. Okay, thank you. Yeah, that's pretty much what I wanted to know is, okay, so that I could, when I read it, I could understand what it was, the numbers were equated with. Okay.
Right, this document, it's straight from the system. It's not a very good read. It's very disjointed. But if you look at the NC,
now I realize it wasn't just me.
If you look at the NCDTS report on page 2, there's a box there that lists the applicable codes. So and even that is not as clear as I would like it to be, but that's the one guide in all these documents that we could get in there out of the system. And I agree that if we could manipulate it a little better, it sure would be more beneficial, more understanding.
Yeah. Okay. All right. Thank you.
You're welcome.
Okay, thank you. And I actually just had one more item I wanted to bring up, which was item 20-0291 about the need to pull $1.5 million from the general fund balance to cover possible shortages in our benefits plan. And I know we did get some good follow-up information from staff on this, but I just was concerned because it didn't come up in just very recently in our budget discussions, and I know we always are cautious about withdrawing from fund balance, but I just wanted to get an idea from staff if we had to do this last year for 2.5 million, and we're doing it again this year, 1.5 million, I guess I have a few questions. One is, what is going to be our strategy? Well, I guess, did we actually add additional money into the budget this year, anticipating that because of last year we would need additional funding? And so whether we did do that or not in this year's budget, and also if this is a trend, what are we going to do about it? You know, what options do we have, and how often do we get statements from Cigna? I know our system was down, but were we still getting regular information from Cigna all along? How often do they give us data about how we're tracking in terms of our expenses? So those were just my follow-up questions.
Hi, this is Claudia. Can you hear me okay?
Yes, thank you, Claudia.
Yes, we've actually brought this item to the board for the past 4 or 5 years, typically in May or June of each year, typically in June. It doesn't happen until about the last meeting in June because of the timing of the invoices. It's a lag in invoices with insurance payments. So you may have doctor visits in May, but it's not until June when those actual invoices may come, or even later than that. So yes, we did have bills up until that point. The gap is smaller than what we've seen in the past. So we did not think that we would need to come to the board for this. This is just a safeguard because of some of the patterns that we're seeing this year is much different than in the past. In the past, in April, May, June, the patterns were more consistent. And so we could gauge based on the first 9 months of the year what that last quarter would look like. For this year, because of COVID-19, and we did explain some of this, the patterns of how employees are going to the doctors is different. And that's across the country. Also sent some documentation about that. We also shared in the documentation that some of the challenges with cost containment, as we shared, the pharmaceutical costs are large components of it, and some of those factors we cannot necessarily control. We do with our vendor optimize on rebates and other types of savings. We also go to the market to look at how we can make sure we're getting the best pricing for the actual insurance company, and that's why we went to Cigna. One of the challenges with pharmaceutical costs, and we put in the study, is just the pricing structure in the United States in comparison to other countries. There were some examples of Avastin, and that came to mind because of my late husband's use of that. That was almost 200% higher in the United States versus what's being paid in Switzerland. And so those cost containments, we just can't get in front of. And as we work with our legislators to possibly look at putting this in the forefront of agendas for what the country can do at a federal level, that would be helpful. For us, there's a lot of efforts happening in HR for behavior modification and ways to look at how do we control some of those factors that cause people to need medicines and other things. So that just gives some context from a fiscal perspective. I know the Human Resources team can weigh in further, but we strive to try to contain costs as much as possible.
Thank you, Claudia.
And this is Susan. Before HR weighs in, I just wanted to let you know that I think what went out today also was the fact that we have, the LGC will not let you retroactive a budget amendment. So this is a safeguard to make sure that we don't exceed budget. And we can always adjust what we're transferring the next year, because like I think the email correspondent said that we don't anticipate it, but we're just trying to safeguard that we don't exceed budget, just in case with all the unknowns.
So when would we know for sure, and then would we put the money back into the general fund balance at that time?
Per GAAP, payables stay open 45 days after June 30th fiscal year end. So we wouldn't know until probably mid-August or between mid-August and the 1st of September what the final costs were.
And I guess, what have we done in the past? Have we reimbursed fund balance?
Commissioner.
I
Commissioner. Hi, Commissioner Jacobs. This is David Ades.
Hey, Dave.
Yes, what happens is we budget that full amount. I think last year, if I'm correct, we budgeted $2.5 million at this time of the year, and we only actually used about 1.1 of it, if I recall correctly. So what kind of happens is you budget the fund balance, but you only actually transfer or use that amount if it becomes necessary, if you have that. So this year we anticipate, I think one of the emails said, at the most, we would maybe anticipate using about $500,000 of this budget amendment. The rest of that million would essentially stay in fund balance and would not get used or transferred.
And just remember, at CAFR level, this is a wash. At CAFR level, there's no impact on fund balance.
Okay. If we end up spending this amount, will this then become a recurring cost?
This is Kathy, and we're not saying that this would become a recurring cost because we base these numbers on trends. Of course, we will never actually know what we might incur, but we use trends to determine how to set the budget. And in this particular fiscal year, we're thinking that we may have been just maybe $500,000 short. But again, we could be wrong about that as well. It's just we have to wait until we see what actually comes in. And again, I think Claudia and Susan have explained it quite well. And in addition to that, I told you a little earlier that we were not able to enter our stuff after the cyber attack timely enough for us to get this information to you all prior to this time. But in normal circumstances, when we have our system up and running, we would know this information a lot earlier.
Okay, all right. Well, thank you for that further information. And so we will now consider adoption of the consent agenda items, which are 20-0226 through 20-0299.
So moved.
Second.
Okay, moved by Commissioner Reckow, seconded by Commissioner Howerton, and we will vote by voice, starting with Commissioner Howerton.
Yes.
Commissioner Reckow.
Yes.
Commissioner Hill.
Yes.
Commissioner Carter.
Yes.
And I'm a yes. So the consent agenda is unanimously approved. I just want to give a shout out to Greg for bringing forward the broadband study that we included in our budget 2 weeks ago and bringing forward that contract right away. Thank you so much, Greg, to look at equitable access for all of Durham County, especially northern Durham County. Thank you. Want to recognize Perry for all the things that you're involved with all the time and all the things that you bring forward, and for the DFI contract with DSS. And I want to acknowledge Commissioner Reckow because we are tonight appointing Stephanie Williams to the Go Triangle Board, which she will be a great appointment as one of the vice presidents of Duke to be serving on Go Triangle and stepping into Ellen's footsteps as the joint city-county position. But Ellen, I really just want to recognize you at this moment. How many years have you been on either, before it was Triangle, TTA, and now Go Triangle, being a part of this board?
I'm not sure the exact number, and it was in 2 different roles. But what's interesting is when I went on the board, the first year was when we created the Triangle Transit Authority in 1989. And then I believe I served for the first time in 95 in a county slot for about 8 years, and then had a hiatus and then came back. Again, maybe in a county slot. I think another commissioner took the slot for a while and then didn't get reelected. So there was an opening. I went back in for a while, and now I'm actually in a joint city-county slot. So different stints, 3 different stints, but something that I certainly have enjoyed participating in, and I think we've made a lot of progress over the years.
Thank you, Ellen, and you have certainly been at the forefront leading transit in Durham County and in our entire region, so thank you. Okay, next thing on our agenda is just very brief discussion about Juneteenth. About the county's consideration of creating this as a holiday for county employees. And Commissioner Howerton, I know you wanted to comment on this. And
yes, Madam Chair. You know, Juneteenth, in 1863, during the American Civil War, President Abraham Lincoln issued the Emancipation Proclamation. Now, we have been celebrating. This didn't just start with somebody that has been claiming Juneteenth. So we've been issuing proclamations for a while, but the thing that we have not done is have that be a holiday. And I sent an email to all the commissioners and ask that we have a conversation, bring it back in September, and that we have a conversation about it being a holiday for all of the county employees. You know, this was, even though that proclamation in 1863 declared that that there would be the end of slavery, but to this day, slavery still exists. And for us to, as commissioners, to be able to do something that says we appreciate the people that work for the county and give them a paid holiday, I think it's a conversation that we need to have, and the time frame be around September. I hate that we didn't have an opportunity to do it this year, but we can work on it for next year.
Thank you, Commissioner Howerton, and I strongly support this suggestion. I think that we see, you know, a lot of people, there's been a movement to make this a national holiday for quite a while. Excuse me, I just wanted to say, yeah, the national folks are working on it, but how long it'll take them to get it done? Right. Who knows? So Durham can go ahead and get started. Right. I think that's a great idea. And I guess I would ask, if we're going to discuss it maybe at our September work session, it also gives staff a time to look at that, how we would go about doing that. I would also love to have Quayle weigh in on it. And, you know, I really appreciate the way the city and the county jointly celebrate Martin Luther King holiday and Martin Luther King Day. And to me, this also seems like another holiday that we could really give a lot of focus and a lot of meaning to also focus a lot of education around it and just the way the county approaches it. So I would love to hear staff's ideas about that as well, and that will give more time for the staff to really look at it and bring back their ideas and their suggestions on that. So we'll take that up in September at our September work session. Okay, so the next item is to talk about Grail. We have a public hearing on this issue, and I'm assuming that this is Andy Miracle who helps us with this.
That is correct. Good evening, Commissioners. Can you hear me all right?
Yes.
Fantastic. This is Andy Miracle, Durham County Economic Development Officer. The board is requested to hold a public hearing tonight to consider allocating a total of $925,000 in economic development funds to Grail Incorporated and authorize the county manager to enter into preliminary negotiations and execute an agreement with the company. Grail is an innovative healthcare company pioneering a test that detects more than 50 cancers with a single blood draw. And they will locate their new lab facility in Durham County, creating 739 jobs and investing $111 million. With the investment, Grail will bring...
Andy, we just lost you. Okay.
Headquartered in Menlo Park, California. Grail has developed a testing approach supported by evidence from a population-scale clinical study program believed to be the largest ever conducted in genomic medicine. Grail's team of leading scientists, technologists, and clinicians are working urgently to revolutionize cancer detection. With approval of the award, the company has agreed to make reasonable efforts to participate in several workforce partnerships that include engagements with Durham Public Schools Career and Technical Education, Durham Tech BioWorks Advisory Committee, NC Works Career Center, Durham Public Library STEAM Center, and North Carolina Central's Bright Center, among others. Please find additional project details, including a full list of partnership terms and project attributes in the briefing sheet attached to the agenda item. Grail's project in North Carolina will be facilitated in part by a job development investment grant approved by the state's Economic Investment Committee on June 2nd, 2020. Over the course of 12 years, the project is estimated to grow the state's economy by $1.2 billion. Durham County payments only occur following performance verification that the company has met its incremental job creation, investment, and criteria targets. Staff is recommending that the county provide $925,000 in economic development investment funds to Grail Incorporated, subject to performance goals being met by the company related to timing and amount of investment, employment creation and maintenance of the created jobs, as well as partnership engagement criteria. The public hearing has been advertised as required by law. That concludes my remarks, but I am aware that I believe, have public comments, and I would also like to point out that we do have a company representative available to make comments as well. So when you see fit to hear from the company representative, let me know, and I will introduce the individual.
Okay, thank you so much, Andy. And let's see, okay, just looking at a message here from Monica. But anyway, thank you so much. And you know, we're very fortunate that here we are in the middle of a pandemic and, you know, a recession, you know, record unemployment in Durham, and having this opportunity for economic development is pretty amazing for our community. So I will now open it up to commissioners who may have further questions before we open the public hearing. Commissioners who have, I heard somebody.
Yeah, it's Commissioner Howerton. I have just one.
Commissioner, yes.
Yeah, I have just one quick question. Notice, how do we go about notifying the public of these positions? What will be done to notify the public?
In terms of the jobs that are coming online in future years. Okay. Yes, ma'am. So, you know, we are, if you think back to the conversation that we had on June 1st, we are really putting together a pretty comprehensive network of community partners from the Chamber, NC Biotech, Made in Durham, to really better advertise the positions that we are recruiting. So with that is part of the Bulls initiative is a significant awareness campaign. So we understand that awareness in marketing is currently a significant deficiency in terms of Durham residents being aware of the employment opportunities that are right here in the county. So that, not only for this project, which will be coming online in future years, but for other projects that we have more recently recruited as well, comprehensively, we look to really better market all of those available positions, as well as the certification education requirements needed to compete for those positions.
So specifically, how will that happen? Will it show up in the newspaper? Will it show up on social media? How will it show up for folks?
I would anticipate that is going to occur through a number of mediums, including social media, paid advertisement. Part of that is we really need to hear from, we need to better understand how we can connect to youth in a meaningful way. So we can use some of the traditional and current mediums, but part of that is digging in to say, how do we reach our intended audience? So that will maybe require some, additional outsourcing of that marketing effort.
Yeah, I'd love to see some way of making sure that the information is provided, because so many people don't have access to the information. So we have to do a better job in making sure that the information is available to our young people.
I would agree, and that is going to be a significant point of emphasis of the larger Bulls initiative and how we communicate these employment opportunities.
Okay, thank you.
Yes, ma'am.
Madam Chair.
Other Commissioner Hill?
Sure. Just going to piggyback on my colleague right now. I think also a clear timeline needs to be established. People hear about these incentives that we're passing, and they think that jobs are going to be available next week, right? I think there needs to be on our website a clear time of when these jobs are going to come online. And as my colleague said, as Commissioner Howard just said, there needs to be a clear pathway for the community to get to these jobs. But I think a timeline is essential.
That's a very good point, and we will absolutely do that.
Okay, Commissioner Rakow.
So, Andy, in terms of payment to the company of the incentive, is it going to be linked to the investment creation over the period of years, the job creation, or both? And tell me how many years the payment will be phased in. Tell us.
Yes, ma'am. So yes, at the county level, our incentive calculation is driven primarily by the investment. So we when we're putting the agreement together, we correlate payment after the occurrence of significant investment, and moreover, we need to see that the projected and actual tax revenue essentially doubles the investment payment for that year, since that is how we derive the calculation when we look at 50% of anticipated revenue. So we would see that play out every year in which there is an investment schedule. And so typically that payment schedule occurs over 7 years. And we would approach it the same way for this agreement.
And you will be verifying with the tax office that the threshold has been reached, that's been promised supposedly in terms of the investment, that we actually reach that threshold based on our assessed value of the company?
That is correct.
Okay. Because we stretched on this one and went pretty high as a percentage, so it's very important that that threshold be reached. That needs to be very clear in the contract.
Yes, ma'am.
And, you know,
Clear of the time here, everyone. Any other questions before we open the public hearing?
well, I'll stop. I was going to just raise that with all these firms coming in related to the life sciences and biotech, we really do need to ramp up our training in biotech. So the capacity at the Northern Durham campus of about 100 students a year is insufficient.
Absolutely. Any other commissioner comments before we open the public hearing? Okay. I will now open the public hearing, and I know we have the applicant who is here with us tonight. Andy, do you want to introduce him?
Yes, I believe we have two representatives. Michael Myers, who is the Financial Planning and Analysis Director, has some comments prepared, I believe, as well as Avinash Petty, the Director of Engineering Operations.
Yeah, thank you, Andy. Hello, Commissioners. Good evening. We're really excited to join you here tonight, and very excited about the opportunity to expand into Durham. I'm leading this project. I've been working on this for about 9 months, and have really been plugged into a lot of the people there in Durham, and the outreach to help us find a location as well as to start hiring here in the very near future has been amazing. So I want to thank everyone for that. Our mission as a company is to detect cancer early when it can be cured, and our purpose is to save lives. As many of you know, cancer is the second leading cause of mortality globally. Almost 10 million people a year lose their life to cancer. A big determination of the outcome of a cancer diagnosis is when the cancer is identified. So if you find cancer early and it's localized, the 5-year survival rate's around 89%. If you find cancer late and it's metastasized, the survival rate is around 21%. So a big factor in whether or not someone survives cancer is when that cancer is found. We've worked really hard over the last 4 years to build this test that will detect 50 cancers and also identify the tissue of origin where the cancer originated. So our whole goal is to, maybe not eradicate cancer, but pull cancer diagnosis up much earlier and improve the outcomes for the people that are diagnosed with cancer. So we're really excited about this. This is a big shift for the company. We've been an R&D company for the last 4 years, done massive clinical studies to prove our test, and now we're shifting to commercialization. So this factory, we call it, or plant in North Carolina will mark a big change for our company to move towards that direction. So we're really excited. You asked a question about hiring. We've already opened positions for North Carolina. They're on our website, but we're also working diligently with people there locally in the Chamber of Commerce and other areas to get these jobs posted more broad than just our website. So it's really important for us as well to get these jobs out there and get people interested in our company. So
well, thank you so much,
Commissioners.
Thank you so much for being with us tonight, Michael. And we're glad you chose Durham County for the manufacturing, and we're about the range of jobs for the levels and the good pay and benefits that come along with these jobs. And we really want to partner with you as closely as possible to really create a strong pipeline for Durham residents to have the training and to know about these jobs so they can be first in line for them. So thank you.
Thank you.
And was there somebody else from you all, from Grail? I know, Andy, you mentioned another person.
Avinash, he will not be speaking, just myself.
Okay, okay. I know we also have somebody who sent in a comment. Monica, do you want to read that?
Yes, ma'am, I can. The comment reads, "Good evening, Commissioners, Mr. Manager, Mr. Attorney, staff, neighbors, and friends. On behalf of the Greater Durham Chamber of Commerce, we appreciate your continued support of opportunities that address global health issues and will benefit all Durham residents, both directly and indirectly. GRAIL represents an opportunity for Durham to continue to lead the charge in addressing global health crisis. As we continue focus on increasing equity access to all the facets of our community and specifically to our growing life science industry, your partnership with GRAIL enables their investment in Durham to help support all of our shared priorities and is an opportunity for Durham to continue to be a global leader in the field. On a personal note, it has been a pleasure to have had the opportunity to work with many of you in our shared efforts to move our community forward. As of June 26th, I will be leaving the Durham Chamber to embark on a new adventure as President and CEO of the Greater Warrior Business Alliance in Illinois. Our success here in Durham has inspired me greatly, and I look forward to continuing to support Durham as a native, local business owner, and as an artist. Durham will always be my home, and I thank you for all your hard work towards continuous improvement in our great city and county. Best regards, Joshua Gunn, Vice President, Member Investment, Greater Durham Chamber of Commerce."
Okay, well, thank you, Monica. I did not know that was in the future of Joshua Gunn, so congratulations to Joshua, and we will miss him. But that is wonderful news for him. Before we close the public hearing, did any commissioners have any comments or questions for Mr. Myers? Okay, I will now close the public hearing and bring this back before commissioners. Any other comments or questions regarding this item?
Madam Chair, I would like to make a motion that we approve the incentive for GRAIL.
Second.
Okay, moved by Commissioner Reckow, seconded by Commissioner Hill. Before we vote, I actually had a question. I just wanted to, Andy, I appreciate you with the, I forget what you're calling it now, the sheet, the project sheet. What is the correct term?
The briefing sheet.
The briefing sheet. I just want to clarify, will the briefing sheet be included in the contract in some way?
Well, that essentially outlines the agreement criteria.
Okay, okay. So what is in that briefing sheet, we can expect that, and the community can expect that to be part of the contract.
That is correct.
Okay, okay. I just wanted to clarify that. Because I want to note there's a lot of important things in there about paid summer internships and job shadowing, scholars at work program, and things like that we really want to see happen. And also, could you clarify how much is the state contributing with the JDIG? What is that amount of the state JDIG?
If I recall offhand, I would need to double check on that.
Okay, okay. Okay, so,
Madam Chair?
Yes.
Madam Chair, given your follow-up questions, I'd like to amend my motion to say that I would move that we enter into an agreement with GRAIL approving the allocation of economic development funds and that the agreement reflect the provisions in the briefing paper as submitted by staff.
Second.
Okay. All right. So moved by Commissioner Reckow as amended, seconded by Commissioner Hill, and we'll take a voice vote. Commissioner Carter.
Really like the new motion. Aye.
Commissioner Hill.
Aye.
Commissioner Reckow.
Aye.
Commissioner Howerton.
Aye.
And I'm an aye, so that is unanimous in support of the economic incentive for Grail. And I just want to say that I think I'm expressing the sentiments of everyone on our board that there's really an urgency to making sure that this is part of our strategy to help our community recover from COVID. When Durham County has, let's see, the data is, I think, about 37% of the lifetime state, and we've had about 2,500 new job announcements in this area, biopharma, life science, just in the past 18 months. And this will create 739 jobs over the next 7 years. And it is really urgent that we get our pipeline going. And I know we're going to hear more about this later tonight, but it's really incumbent upon all of us that we make sure our residents who have been displaced from jobs and our high school students get these good jobs. All right, next we have a public health update on COVID, and we look forward to always hearing from you, Rod Jenkins, our awesome public health director. So I'll turn it over to you, Rod.
Thank you, Madam Chair, and to the board and to yourself. Good evening again. It's a pleasure for me to provide you with a COVID-19 update. And as mentioned previously several times, you guys have a full agenda, so I'll be as brief as I can and open it up for questions. Currently within the U.S., we're sitting at little under 2.2 million cases of COVID, resulting in 119,923 deaths. Within North Carolina, we're sitting at 53,605 cases of COVID, resulting in 1,223 deaths. In Durham County, we're at 3,267 cases of COVID, and we still have 62 deaths. We have 548 active cases, and I'm certainly happy to report that we have 2,574 inactive cases per DHH guidelines, meaning that
Did we lose
our
you?
staff.
Oh.
Can you hear me?
Well, we lost you for a second. Now you're back
Okay.
again.
I'm sorry. I don't know what part you missed me on, but I will continue. Staff continues to work really hard, and some trends that we're seeing in terms, well, I'll be remiss in not talking about contact tracing. Since June 6th, the Durham County Department of Public Health itself has contacted over 2,300 individuals and entered into our system as of prior to June 6th. That's how much we did. But we have also attempted to contact 3,643 contacts. So from time to time, there's a number of questions about contact tracing. And I just want to say that we always welcome more help, but again, we have done an admirable job of doing contact tracing ourselves. But we've entered into a great relationship with CCNC, and we continue to work really hard with them. We're in constant contact with them on a daily basis to really hear about their cases and what they're hearing from our residents. Moving on, the average age of our cases is down. It's 39. At one point in time, it was those individuals who are 65 years of age and older, it has started a downward trend. And of note, we're definitely starting to see an increase in cases under the age of 18. And Durham is no different than the United States. It's been reported that nationally, they're starting to see a trend of COVID cases in children, particularly those under the age of 18. The rate of this age group is currently 16% of all our cases for the month of June, and it is predominantly in our Latinx community. Further breakdowns for the month of June, 79.5% of our cases for the month of June as of today are in the Latinx community, 15% in the white community, 13.20% in the Asian community, and 0.5% in the, I apologize, 13.20% in the African American community and 0.5% in the Asian community. Do apologize for that misquote. We are also seeing an increase in community spread, with 30% of our cases in June being attributed to community spread. So we're starting to see a little bit of an increase in our community spread creeping up. Zip code 27704 remains the zip code most impacted by the rate of cases, with every 16.66 per every 1,000 residents in the zip code. So we have alerted the state and the CDC that zip code 27703 and 27704 are those areas that we certainly would like additional assistance with. Turn it over to resources. Help is definitely on the way, and as I've said many times before, I'm not one to turn away help. We definitely want all the help that we can get. So 13 out of the additional 25 contact tracers from CCNC have been hired. They still have to hire an additional 12 for the 25 that we requested. And they are about complete with their training, and they should be starting after they've been cleared for training. So we look forward to them starting sometime next week. We will receive assets from the CDC. 5 contact tracers will come from the CDC Foundation for an 11-month period. So they will be with us for 11 months. We also will get 1 case investigator from CCNC to accompany the 2 that we already have. And we will receive 1 epidemiologist for a 21-day deployment from the CDC. So those are definitely great assets to help us in our fight against COVID in Durham County. I will be more than happy to take some questions. As indicated, I know you guys have a packed agenda. At this time, I'd definitely like to entertain any of your questions.
Thank you, Rod. And I wonder if you could just also mention the new testing sites that are going to be, again, trying to target the needs of our Latinx community.
Absolutely. We did have 2 new testing sites, and forgive me, the addresses escape me right now. I'm going to try my best to bring them up, but I know they're CVS testing sites, and they have been onboarded and live for the past 2 weeks, and I am continuing to work with Courtney Herring, who is the governmental relations individual for CVS, and I am very much pressing for additional sites in East Durham, because again, those two zip codes that I mentioned are located in East Durham, and those are the areas that we can see has the most need. I've also petitioned Walmart, and I've also petitioned Walgreens for additional sites, so we're certainly hoping that we're able to get that in Durham.
And Rod, what about El Centro and Holton, the plans for those locations?
Absolutely. We do, as a part of our testing strategy, we are expecting within the next 2 weeks, in partnership with our healthcare coalition, to begin testing, expanded testing at Holton Rec Center and also at El Centro Hispano. And again, this is a part of our efforts to ramp up testing. We're just finalizing the logistics as far as who will do what and small things like traffic control and also procuring PPE and additional testing reagents from the state. But we are doing a very good job of working with Duke University Medical Center, who has also committed to ramping up their testing through different conversations with Secretary Mandy Cohen and with work with us in Durham County. So we hope to have that come online either toward the end of the first week of July or definitely by July 11th. We plan to have that in action. We will have staggered times to definitely to attract those individuals who work long hours in the day. So we will have some evening hours and then we will have some morning hours on the weekend. So that's all a part of our strategy. So more information to come with that.
Thank you. Questions from commissioners? Commissioner Reckow?
Thank you for that excellent report, Rod. A question I have is, I read a few days ago that the Department of Health and Human Services at the state level is sending money our way. I thought I saw over $1 million headed to Durham to help us with combating COVID. Is that true?
That is true. Yes, ma'am. Thank you for bringing that up. I guess the reason why I hadn't said it because I haven't seen it yet, but it's supposed to be 1.296 million, and it's really based upon population and the number of cases, disease burden, if you will. So it's also there's some strings attached, as you would imagine, Commissioner Reckow and other commissioners. You have to be well underway with CCNC's tool, which they affectionately call CCTO. There's a lot of acronyms, which Durham is. You have to have a testing strategy. You also have to be working with historically marginalized populations, which clearly we are in Durham. So rest assured, Durham Public Health is definitely checking the boxes and ensuring that we have what we need in order to garner those funds. I'm also happy to report that there's additional funding that's not necessarily has strings attached, a smaller pot of money, but funds coming nonetheless. And couldn't have come at a better time because there are just a lot of things that we need resources for in our efforts to really help out our Latinx population and to really expand our ability to test countywide.
Thank you.
Yes, ma'am.
Any other questions?
So, Madam Chair, I have a question. Just, so Rob, with all of the openings and the gatherings, what would you say to the community at this point, given that we seem to be increasing in numbers? What would you say to the community around gatherings? I think that's what I'm getting at.
Great question, Commissioner Howardson, and thank you so much for asking that. I would just say to the community that now is the time to continue to be resilient and to continue to be vigilant. I know that Durham is no different than other communities throughout the nation, throughout the state, that has COVID fatigue, as they say. And the weather's beautiful and it's summertime, and this is what we're accustomed to, shedding our winter layers and getting sun. And I know that as a participant and a member of the Recovery and Renewal Task Force, this is something that we brief Chair Jacobs and Mayor Schul on in terms of our concerns. And some of the major concerns we have is mask wearing has seemed to begin to dissipate. And you can go places, at one point in time, you would see a lot of Durhamites with their mask on. Now you're starting to see a little bit less. So as far as gatherings specifically to address your question, I would continue to discourage mass gatherings. I would continue to encourage, no more than 10, if at all possible. If you're outside, no more than 25. Continue to employ the main W, which is wait 6 feet apart to socially distance. But employ all the W's, which continues to be wash your hands, wait 6 feet apart, and most importantly, wear your mask. I heard Katie Galbraith said it so nicely and so eloquently. Wearing your mask is an act of kindness. You may be fine, your loved one may be fine, but you never know what you're transmitting. And you may transmit it to somebody with significant comorbidities that could end up dying. And I don't mean for this to sound so morbid, this is real. People are still dying because of COVID. And oftentimes it's not until it rolls up to your doorstep and rings your doorbell for you to understand how serious and significant COVID remains. Until there's a cure, you cannot let up. You have to continue to be vigilant and do the things that the CDC and DHHS is recommending, because we're not out of the woods yet. We still have a global pandemic on our hands. So I certainly hope I answered your question, Commissioner Howard.
I think you did. Thank you.
Thank you. I don't think anyone could say it better, Rod. Thank you so much. And we have been talking a lot at the Renewal and Recovery Task Force about what we need to do to help support people wearing face coverings, because it's one of the most effective tools that we have at this point. So we're looking at some efforts in the next week or two that will hopefully help support that. But thank you again, Rod, and all of your staff for everything you've been doing.
Always a pleasure, Commissioner, and thank you to the commissioners for your undying support. We appreciate all of your efforts and support for public health. Thank you so much.
Thank you. So we'll move on to guidance for reopening Durham County government and temporary personal travel and high-risk activities guidelines. And let's see, Mr. Manager, are you or Kathy? I don't know who.
Yeah, Madam Chairman, we have staff that will lead this discussion, but I just want to say I do not think that this will take 45 minutes. Just to give the board a framework, for the last probably 3.5 weeks, we have been very intentional about developing our reopening guidelines once that time comes, along with some supplemental work around how we handle high-risk activities, travel, and otherwise. And so I think that the staff can probably get through this pretty quickly and save you some time, because, at the end of the day, all of these are administrative things that we will be doing internally to get, the staff back in place when we do. And we just want to sort of give you a high-level overview of the work that we have done heretofore.
Okay, thank you, Mr. Manager. And so I guess I don't know who's taking the lead. Kathy?
Yeah, we have a couple of
okay.
people.
Thank you.
Good evening. Actually, Dara is leading the conversation. Dara, are you on? Can't hear you. No. I'm sorry. Dara is speaking, but we can't hear her.
And Dara, maybe if you call in, I always find that works better for me than talking through the device. Maybe that might help.
I actually unmuted Dara's mic. I don't know if that will help.
She's going to try to dial in.
Okay, perfect.
Good afternoon. Can you hear me now?
Yep, sounds great.
Okay. I do apologize. I'm not sure what happened, and I was trying to share my screen, and it locked me up. So I'm not going to share it because you all have the document, but I'm going to walk you through the document today. So I do apologize. Good evening, Commissioners, Chair Jacobs, County Attorney, and all on the call. So I want to start off with this evening. We want to actually review and walk you through the reopening guidance for Durham County and the temporary travel and high-risk guidance for employees. I just want to cover some of the high-level points of the document and see if you have any items that raise concern. So I'm going to kind of put this information in buckets from the two documents. So let's start off with the guidance for reopening Durham County. First, social distancing. In the document, you would have seen a number of key points around that. There's a section that's around attaining minimal staff in public and office settings, reconfiguring workspaces, and develop strategies that address face-to-face contact. These particular sections focus on us allowing, having the minimum amount of staff on site so that we're able to social distance appropriately, but also reworking and utilizing our existing space so that we are able to have individuals in the office when appropriate, and that these individuals are able to show social distance and limit face-to-face contact. So as we work through this, we have made a number of recommendations, from having cohorts that exist of very small teams to minimize the number of employees in the office, to also doing things around this with our reconfiguring our workspaces. So it may be that some of the spaces we currently have need to be configured a little differently in order for us to leverage those spaces appropriately. Let's see. In addition, we've got the next item I want to talk about are the face mask requirements. With the face mask requirements, we are able to provide every employee here at Durham County with face masks and also individual hand sanitizer. When it comes to the face mask, we're able to, we're encouraging, as per the Durham County ordinance, face masks are required, and they're also required on site for employees. In addition to anyone that's coming on site to receive services, they're required to wear a face mask in addition. So we're able to have face masks for not only employees, but those coming in for services as well that have to come on site for services. The next section I want to talk about are the items that fall up under healthy workspaces and sanitation. With healthy workspaces and sanitation, there are a number of things we've done. One of those includes making sure that we have sanitation equipment available for employees to sanitize their own workspaces. General Services has also made sure that they have education materials for not only the janitorial staff to ensure that they're doing a certain level that's required of sanitation, but also for the staff. So there are times that employees may need to utilize open spaces, so that therefore those employees have guidance so they know how to properly sanitize those spaces. So as we work through that, we want to make sure that employees not only have the materials to sanitize, but they're aware of what they're supposed to be doing and the guidance to do that. In addition, I want to include that General Services has also worked on HVAC optimization, and that includes having the air so it's not recirculating through the building and bringing in fresh air to help keep the employees safe. The next item is the virtual services and telework options. So in the document, we include a number of discussion points around promoting virtual service offerings. So wherever possible, if we can provide virtual service options, we absolutely do. If there are services that we can provide to our citizens remotely, let's do that. In addition, we also encourage telework when at all possible for employees, and any meetings, if possible, to be conducted virtually. Just like we're doing now, we have tools in place so employees are able to conduct meetings virtually and not do them face-to-face. We have a number of additional resources behind the telework piece. We're making sure that employees not only have tools, but additional training on how to leverage some of these new collaboration tools that we have here at Durham County, putting resources out on MyDeco, our employee intranet, to make sure that they have any kind of resource they need, or if they need to ask questions or additional help from IS&T, that's available. I do want to also share that a piece of this work that we're doing includes the surveys to departments to ensure that we understand the department needs, because one department needs around reopening may be different from another. And we have some departments that have already created separate guidelines that have these same strategies in place because they've not been able to completely shut down like some departments have been able to do. So with the guidance of our wonderful public health director, a number of departments like public health and DSS have been able to create guidance documents that have these same principles embedded in them. And then the last part I want to talk about from this particular document is the building screening. When it comes to building screening, it's ongoing piece of work that we have to continue to do, screen not only our employees, but individuals who are coming in for services. And we are working on leveraging some new technology that includes thermal imaging to assist with the screening process. So before I go any further, are there any particular questions that you all want to talk about with this first document before I go to the next one? Okay, so I'll move forward to the next document, which is the temporary personal travel and high-risk activities guidelines. This particular document is a little different. The purpose of it is to help minimize the transmission of COVID-19 in the workplace and assist employees. I'm sorry, yes. Okay. And assist employees with guidance for personal and business travel to help reduce or even eliminate potential COVID-19 exposure from high-risk activities. Yes, can you hear me?
Yes, Dara, could you, I don't know if you could hear me before I was trying to ask a question. Can you hear me?
I'm so sorry. Yes,
That's
I can.
okay.
Hear Becca.
Okay, I'm sorry. I had questions about what you presented so far. What is going to be the approach for employees that may have pre-existing health conditions? And I didn't see anything about that, about employees who really have to really keep working at home.
So we do have a process in place for that. We do have, employees can request ADA accommodations, and we work with those employees through our ADA coordinator to make sure that we meet the needs for those particular employees. So if they, and we're able to accommodate them either in the workplace or remotely with remote working, then that's one of the options as well. But that is in place right now, and it's been ongoing work since we began telework.
Okay. And also just thinking ahead to what's going to happen with Durham Public Schools, it seems that for parents, maybe kids will be going twice a week, and we're going to have a lot of kids that probably are still going to be at home for at least part of the week, even if they can have some in-person school. And I'm just, again, thinking about our employees who have kids that are school age. Has there been any thinking about how we'll accommodate that?
So currently we have procedures in place to accommodate employees who have to balance that work-life balance with the children being home. There's an extension right now that's been in place for with FMLA. I think it's a part of the CARES Act that we've been leveraging and using. And in addition, we'll be including the telework option to best work with the different departments to support those employees' needs. This is an evolving situation. Unfortunately, we learn something new about COVID and the impacts of it every single week, and we have to adjust and kind of shift as necessary to support the needs of the county and the employees at the same time.
Right. And I know just from being on the DSS board that there's been a supply chain pipeline issue even with getting people computers so they can work at home, and I just didn't know, is that something that you're seeing across the board with trying to support teleworking, just getting people the equipment that they need?
That is something that we're seeing, and we're also trying to survey the department heads to make sure that we understand their needs as well. And so as we work through this, because the equipment shortage is something that they're seeing around the country, everyone is trying to adjust and accommodate for teleworking where possible. And so we're working on a number of things, not only getting the equipment in, but also doing things like staggering work schedules so that some employees may be home with their children on 2 days a week, while others have to come in, and we shift those and rotate those schedules to accommodate that, to make sure we have the support with the department.
Okay. And I just was wondering too about what about common areas? Like I know a lot of the, what is going to be the approach around water fountains and kind of the kitchen areas? Are there protocols around those?
Yes. Yes, they're working on those as well. We have a number of things going on with common areas, especially with the extra large lobbies, working to make sure that we have those dealt with appropriately. In some areas where you have small little areas where employees can congregate, those have been mapped off so employees can no longer access them because you're not able to social distance in those spaces. We've had accolades that have been added as well in some areas to show employees where actually they need to go, and even our citizens as they come on site when they need to, how to social distance and be separated, and even have mapping to show one way in, one way out when necessary, because some of our smaller spaces may not be able to accommodate two-way traffic.
Right. And do we have hand sanitizer when anyone comes in any building that's just available to the public?
I know that General Services is working on getting the hand sanitizer kiosks in for the public use. We do have sanitizer for employees, but for the public use, I know they're in a number of buildings that are already open. I think that I've even heard departments leveraging some of the local distilleries that have been selling hand sanitizer. So we do have it in place now and will continue. But I do know that we're still working through the supply chain issues that you've been seeing out here when it comes to hand sanitizer, getting more in place to make sure we always keep that available.
Okay, well, thank you. I appreciate it. There's so many details to think about. I know it's really challenging, so I appreciate all your work on this. Thank you.
Thank you. Are there any other questions about the reopening guidance document? Okay, so I will go into the travel document when it comes to the temporary and personal travel and high activities guidelines. So, as I was saying, that this particular document is, we're trying to minimize the transmission of COVID-19 in the workplace. One of the things that we have to take into consideration here at Durham County is that all county employees are actually essential and to be called on site to work if necessary. And so we want to really encourage and be mindful, have employees be mindful of their activities so we can actually minimize the transmission of COVID-19 here at the workplace and also outside. We want our employees to be the leaders and really think about their activities before they engage in them. Because some of the activities, if they're a high-risk activity, could lead to a potential 14-day quarantine. So we want them to be, to realize what they may be getting into prior to them getting into it. So we are asking employees to complete a high-risk activity questionnaire that will identify the activities they have participated in, and that information will be shared back with Human Resources. Human Resources will work with the department director and the immediate supervisor regarding the employee's, if it's a vacation request or if there's an issue and they actually have to take a 14-day quarantine. So in the document, we've defined personal travel from business travel. We are working for people to understand that we are not encouraging business travel. However, there may be an occasion where business travel is needed. Currently, we have the manager took business travel completely off the table to deal with the pandemic. So if the need occurs and people have to do business travel and they're not able to do those things virtually, then there may be a limited number of individuals that have to engage in that. Now, when it comes to personal travel, we know that it's warm outside and some people are excited about maybe taking a trip and getting out. We want people to be mindful of the activities they do engage in. So you can actually take a trip and do some things and enjoy yourself, and they see low risk, maybe even medium risk activities, versus certain activities you engage in may be high risk activities. So let's think about those activities before we actually engage into those activities. So we have forms that we've developed for the employees to complete. The process will be managed by Human Resources, and then we're going to be working with the employees so they have some level of ability to actually enjoy their vacations or their activities that they want to participate in, and encourage them again not to participate in high-risk activities. But if they do and they decide they want to take a trip, for instance, to Florida, upon their return, they will have to be they'll be required to take a 14-day quarantine. And so this document covers the guidelines around that to ensure the employees understand their responsibilities and that they must complete this information honest and truthfully, or they may be subject to disciplinary measures. So are there questions and conversations around this one?
Questions, anybody?
I do want to add that.
All right, Commissioner, my screen is turned blank now, so I can't see if anybody is. Is that you, Commissioner Reckow? Hello?
No, so this is Commissioner Howerton. So
Commissioner Howard, sorry, I can't see any.
Are you saying that anybody that travels will have to come back and go into 14 days quarantine?
No, not anyone. It depends on the activities they engage in. So there's actually a travel request form where employees will request their time off and include the information, some pertinent information we will need to make a decision. So for example, I may decide I want to take a week of vacation and travel out of state to a hot spot like Florida. Well, that particular location and how I travel will all be factored into the decision on what I need to do upon my return. And this is also very important for us to gain this information if possible before an employee decides to travel. So we're asking for a travel request because an employee may or may not have enough time to cover vacation of being out and then supporting a 14-day quarantine. There are certain modes of travel that may be a higher risk than others. So I may get in a car with my family within my household and take a trip, and that's low risk compared to me getting on the megabus and sitting in a tight space with another group of individuals that do not live in my household, and I'm not able to social distance. So there's a number of measures we'll use to make a determination to be able to communicate best with the employee what they need to do. Now, I do want to be clear. If employees are able to telework and their positions support it, they can work during a 14-day quarantine, but not all employees have that luxury. But I do want to go back and emphasize this does not encourage employees. We don't want to encourage employees to think that they could take on high-risk activities just because they're able to work remote, because at any point in time, as an essential employee, you may have to be called into the work on site. Therefore, we're trying to encourage all employees to please have in mind the type of activities they engage in while they're enjoying their holidays.
Thank you. And just thinking about our time frame here, any other questions before we move on to the next item from anyone? I don't have a screen right now, so. Well, thank you so much, Dara, and appreciate again all of the thought and effort and work that has gone into this. I know this is a very challenging situation that everybody's in, and I know that policies like this are unfortunately needed just to help people evaluate their risk and decide how they want to, the decisions they want to make. But ultimately, the focus is on keeping everybody safe. So I appreciate it, and thank you so much to you and everyone who has worked on these policies. Next, we have a discussion on the Durham Small Business Recovery Fund, and Andy Miracle, we will go back to you on this one.
All right, commissioners. Okay, let's see here. Can everyone see the shared screen?
Not yet.
Okay, please let me know when you can see that, or let me double check. Okay. Okay, how about now, or?
Got it.
Okay, fantastic. All right, commissioners, as you are well aware, as a result of COVID-19, we have seen historic economic disruption significantly impacting small businesses in our community. In response to that, we have seen a number of local governments that have established small business recovery funds to increase access to capital. These times are truly unprecedented and require an unconventional response as a result. Being uncertain when and if the new normal will return, this is an opportunity for local governments to respond. So as you recall, at the June 1st budget work session, at the conclusion of the Small Business Recovery Fund update, the board unanimously agreed to allocate $1 million of CARES Act funding to support small businesses impacted by COVID-19 through a term loan program. The board directed staff to receive additional input from community partners and small businesses about their goals for a loan fund and return with a recommendation at tonight's meeting. So given with that, and a logical kind of starting point was to look at what the city had accomplished, with the setting up of their fund, given the geography that we share with the city. And so I will say, as of June 1st, when we had this conversation, the city had yet to even authorize their fund. As of last Thursday, they are now accepting applications. This is truly a very fluid situation. Things are happening very quickly. And I would also note, unlike Wake County, that has 12 municipalities that they share in that county, Durham is a bit different, right? So we're essentially one city, one county, and we have significant overlap with the city. And so that really seemed like a very logical starting point for this conversation, was to look at the city fund, what they're doing, and kind of react to that. In addition to being able to overlap the feedback that we've heard, and we'll also kind of step through some additional options as well. I will note that on tonight's call, we have with us from the Carolina Small Business Development Fund, Kevin Dick, who is the president and CEO, joining the call. Kevin, when I get to the end of these slides that reference your program, please feel free to jump in if any points need clarifying, and Kevin is also here to answer questions as well. So just to quickly run through the Durham Small Business Recovery Fund. So that has been set up in a manner that has $1 million from the city of Durham, $1 million from Duke University, and it provides grants with Duke funding and loans with city funds. So essentially it is a single point of entry that can accomplish both grants and loans. So essentially the Carolina Small Business Development Fund has been partnered with to administer both the grant and the loan, and they are drawing on the recent experience of working with Mecklenburg County, where they administered a loan program, with the city of Raleigh, where they administered a grant program, and they are also partnering in the state's NC Rapid Recovery Fund as one of the many loan providers that are part of that. So really, Carolina Small Business Development Fund is kind of providing end-to-end service delivery, from loan processing, servicing, collections, outreach, and marketing, promote the program, as well as technical assistance to businesses applying for and receiving loans. And we're going to be talking about more. Technical assistance is really a significant part of what this fund has to offer, and we're going to dive into that a little bit more as we go through this. I will note that this approach in Mecklenburg has yielded an approval rate of approximately 50% for minority and women-owned businesses, whereas 50% of the borrowers that have been selected have been minority or women-owned businesses. Looking at some of the program eligibility and grant and loan terms. So, these are some kind of standard terms. I'll highlight that the program business employee maximum is set at 25 FTEs or less, and $2 million in total revenue. So this is where the split kind of happens. So if businesses produce revenue that is less than $500,000, they are eligible for the grants. If it is more than $500,000, they are eligible for loans. So it is one or the other. Businesses must demonstrate at least a 25% decline in revenue as a result of COVID-19. And businesses must have been in operation for a minimum of 2 years in profitable operation for growth trajectory. So obviously that historical revenue analysis is essential into kind of establishing eligibility, and will inform the loan amount. So loan amounts, they range from $5,000 to $35,000. The maximum grant award is $10,000. The term of the loan is up to 10 years, an interest rate of 3%. This loan program is not secured with collateral or personal guarantee, and we'll also address that point a little bit more as we go through the presentation. And the program does start with deferred principal payments of up to 12 months and interest-only payments during the first year. Kevin, is there anything else worth highlighting or that needs to be better clarified through the content so far? All right. Well, Kevin, just to be sure, if you were saying anything, I did not hear, so you might have been muted, or otherwise, might have just been good to go.
And Kevin, if you're calling in, it's star to unmute yourself.
And I just want to make sure that everyone can still hear me. I might have been breaking up a little bit there.
Yeah, we got you. Thank you.
Fantastic. Okay, so that is a very quick summary of the Durham Fund, and we will come back to that as a point of comparison for both understanding the Community Small Business Fund proposal, and then as well when we look at the Rural Center. So we will kind of revisit how that comparison breaks out. So I will note, as it relates to the charge from the June 1 meeting, was to receive additional feedback from businesses, to get additional perspective on community input, what their goals are for the Small Business Recovery Fund. So we reached out to the Durham Small Business Coalition, who's been in communication, is comprised of some Durham businesses and has been in communication with a number of businesses. And their proposal consists of a forgivable loan program to assist in bridging the COVID-19 crisis and help Durham small businesses. And obviously, as you're aware, being in local government, we cannot participate in a forgivable loan program, but did want to take a moment to contrast the community proposal, which they're calling the Duke Durham Small Business Recovery Fund, contrast that with the city fund to gain some perspective on how they differed. So essentially, I included that full proposal as an attachment for reference. There were a number of points of agreement. I'm simply highlighting how they are different with this table. So points of difference, you can see that the community proposal looked at a 50 employee maximum versus a 25 employee maximum for the city fund. The revenue maximum differed from 8 million and 2 million. The city fund included food trucks and home-based businesses, and that was per the direction of council. The initial proposal was limited to storefront businesses, similar to the community proposal. But again, just to highlight one point of difference. And the last point there is businesses in operation of 2 years versus really essentially businesses operating the last 10 months. So for the purposes of this presentation, given that we were charged with getting additional feedback, we wanted to have a fund to be able to contrast against the city fund. If in the event that the criteria within the community proposal or otherwise were significant enough, the commissioners wanted to pursue that opportunity, we wanted to have a vehicle to accomplish that. So we that is administering the NC Rapid Recovery Fund. That is the term loan program that is available to all 100 counties. That includes $125 million of CARES Act funding that was allocated by the state legislature, as well as it incorporates locally funded programs for Wake County and the town of Apex. So essentially, this is an alternative fund if the board decided that they wanted to have their goals carried out otherwise, whether it be the goals in the community proposal or otherwise. So the next slide will contrast the city fund with the Rural Center fund. So kind of going through these line by line, the Rural Center did not have an employee maximum, so they really had a minimum of 1 employee. For the Wake branded program, they instituted 100 employee maximum. So something similar could be done for us as well. Another point of comparison, they did not have a revenue maximum, right? Looking at the interest rates, the city fund is an interest rate of 3% over 10 years versus an interest rate of 5% over 5 years. So that will significantly impact the repayment amount, right? So the city approach is essentially twice as long at a lower interest rate. So you can think about how that monthly repayment amount will differ as a result. When we look at fees, the administrative fee for the city fund is higher, and it does include a technical assistance fee as well. And as you can see in the bullet points below, technical assistance is a significant point of emphasis in the city fund, and we can go ahead and jump down to those bullet points. So both funds include technical assistance for application, process training, and access to other funding resources. But it has been a significant point of emphasis in the city fund to not only provide technical assistance during the application period, but throughout the life of the loan. And really, this is a strategy to not just distribute funds to the small businesses, but really to do everything possible so that they survive and thrive. And you can see some of those other strategies to help pursue that, whether it's coordinating with other community technical assistance organizations, providing a closing needs survey after the loan is awarded, one-on-one counseling, webinars, and so on. Now, to circle back to a few of the other points in comparison, this is also a significant difference when kind of lining up the two funds. So with the city fund, there is the opportunity to earn repaid loan principal coming back to the county. So for all interest payments that are paid, of that 3%, all 3% comes back to the county, but essentially 0.5 of that is a processing fee. So essentially 2.5% of repaid loan principal comes back to the county. So when considering the totality of the costs and benefits, that is something to certainly keep in mind. Now, this is another point of variation between the two. And this is one that it's really kind of percolated up in the last few days as a significant point of interest for county staff. And when we're looking at the city fund, that does not include a personal guarantee, and those are unsecured loans. Versus the rural center, those are include the personal guarantee of individuals with a 20% ownership of the business, and they are otherwise secured with collateral. So this has been a point of focus for county staff within the last few days, as we have gotten additional feedback from external sources. We have heard from our financial advisors, we have heard from the LGC, and we have received feedback from the School of Government as it relates to having an unsecured loan or having a loan that does not have a personal guarantee. And this has been a point of concern for staff when we think about the totality of the calculation of the interest rate. And so at an interest rate of 3%, we are benchmarked with the lowest of our peers in terms of the interest rate. We see that Mecklenburg has taken a similar approach of 3%, but they do require a personal guarantee with their loans. And you know, this is a space that I would certainly defer to legal and finance that have more of an expertise in the background in terms of you know, pursuing that point of the loan. But it is a point of concern for our legal and finance staff. And as I expressed in the email that was sent earlier today, you know, I want to be sure that we express that concern. Now, for full context, it is also, so the original city staff recommendation did include collateral and as well as a personal guarantee. And the direction they received from council was that they did not want a personal guarantee or secured loan. And that is where they ended up. And obviously their staff got to a place where they were comfortable with that as well. So for the sake of full disclosure, I certainly wanted to share that information. And it is one that has really recently come to our attention, you know, when we think about the timing of the recommendation that we put forward and the information that we shared. So when we summarize, you know, the fund comparison, I would say certainly the city, prior to this point of the unsecured loan and the personal guarantee, the staff recommendation was to pursue partnering in the city fund. And putting the issue of secured loans and personal guarantees aside, it would still be that. But that is an issue that needs to be further addressed by the board. So I would say, you know, going through the fund comparison as kind of a final point of consideration. The city fund does have a more favorable interest rate that does have a monthly smaller repayment. There is significant technical assistance over the life of the loan. And when you think about the totality of the mechanisms in place to better secure the loan, so that we do have how we mitigate risk. I think that is an element that needs to be considered. Paid interest income also helps protect our initial investment as well. And that is an option through the city fund that is not available through the rural fund. And I think really importantly too, if we participate in the city fund, we have a single unified Durham fund. Whereas if we establish a separate Durham County versus Durham City Fund, that may be confusing for businesses, and we may lose some efficiencies there. For the Rural Center, there is an opportunity to accommodate over 25 employees. There are lower fees, but I would again encourage us to remember the totality of, you know, the fee structure there and what we're getting through the technical assistance piece. And the Rural Center does offer a secure loan as well. And so kind of being at the end of the presentation, I certainly want to offer Kevin the opportunity to jump in if Kevin is able to participate.
Kevin, are you there? I know you had trouble getting in before. He did have a message in the chat.
I'm
Monica.
texting him, trying to see if he can call in if need be.
Well, while we're waiting for Kevin, I'm trying to end this item by 9:30 to keep us on schedule, so we have about 9 minutes to discuss this. So very quickly, questions, comments from commissioners?
I have a question.
Go ahead, Howard.
Of the 50% minority and women-owned businesses that you stated, what percentage of are businesses of color, and are they broken down as to race and gender?
And if Kevin was able to call in, he would be able to answer that question. Kevin, are you able to join us? Or if someone else from the Carolina Small Business Development Fund is able to speak to that question, please do jump in.
And that's what's happening in Mecklenburg County, correct? That's not what's happening with the city yet, right?
That is correct. The city fund just opened on Thursday.
Okay, well, we'll have to wait until Kevin gets on to answer that. Any other questions, Commissioner Howerton?
No, I'd like to get that one answered.
Oh, can you?
Oh, I think we heard something.
Hello, can you hear me?
Hey, Kevin.
Good evening,
Nice to
Madam
hear
Chair.
your
How are
voice.
you? Good evening, Madam Chair. Sorry for the communication difficulties here. I believe, and Commissioner Howerton, Commissioner Reckow, Commissioner Hill, Commissioner Carter, good evening. Kevin Dick with the Carolina Small Business Development Fund. Commissioner Howerton, I believe your question was about the percentage of a disaggregated breakdown of minority and women-owned businesses. What I can tell you in Mecklenburg is that thus far, 52% of the businesses that have been approved for loans have been minority-owned businesses, and 40% have been women-owned. We have not yet disaggregated by specific race. We do know, however, that a significant percentage of the applicants that are minority applicants have been Black business owners, with also a percentage being Latino business owners. So I can answer that, based upon the odds are that a significant amount of the minority businesses in Mecklenburg County that have been funded are Black-owned businesses, with the second highest percentage being Latino-owned.
I'd like to get the numbers for Durham, and have it disaggregated so that we know whether they are women. Did I just go goodbye?
Are you asking for, excuse me, Commissioner Howerton, are you asking for a disaggregated numbers for Durham? Is that what you asked?
Yeah. Yes.
The funds just launched on Thursday. So I mean, the applications have just been submitted, so none have been, they're still in review. I don't know if we've even had any approvals yet. With the loan funds, it is first come, first served, but those applications are being reviewed. I believe we've had 12 loan applications. With the grant funds, we have, the launch date was Thursday. There is a sort of a review period for 10 days. We also did significant numbers of webinars, both in English and Spanish, prior to the launch date, so that people would be prepared with the paperwork they needed to have ready in order to apply. And in addition to that, we're doing the 10-day review period
with the grants. So the grants are not first come, first served. At the end of the 10-day review period, there'll be a random selection process. And this is one of the things we do to ensure equity in the process. And so hopefully that answers your question. Again, we really don't have information yet on Durham because the funds just were launched a few days ago.
So when would you anticipate having that kind of information?
I would say when applications are approved, which we expect to start to occur around the end of next week for the grant fund. And for loans, it just depends. I mean, loan applications are reviewed as they come in. So it just really depends upon how approvals go. If individuals are submitting their documents on time, that will dictate how quickly we can review and approve loan applications.
Okay, well,
Commissioners,
thank you, Kevin. So I appreciate that. And as soon as we can, I think we need to get some numbers so that we have some idea of what we're looking at. But I appreciate it, and good to hear from you.
Great to hear from you. Thank you.
Thank you. Other questions? Commissioner Recco?
Hi, Kevin. Good to hear your voice again.
Yes, ma'am. You too. Thank you.
Yeah. So I want to back up and go over some of the key decisions it appears Andy wants us to provide direction on. So if we start with the size of businesses, it appears as though the city's just going up to 25 employees, but there was some community input wanting to go up to 50. But I understand that it would be perhaps less confusing if we had a one Durham fund. If the county decided to change the parameter for our 1 million and go up to 50, would that be doable and stay within this one Durham fund concept?
Madam Commissioner, I think it would be pretty difficult to administer what essentially would be two different loan programs, because you're talking about a very significant difference in underwriting criteria and requirements if you change the employee count. And so you'd essentially be having two different loan programs in what is mostly the same geography, which I think would be problematic.
It's interesting. And any feedback vis-a-vis Andy's raising the issue of 3% loan rate versus 5 or 5.5%?
So I think that the basis of the 3% and the 10-year term was really to keep monthly payments as low as possible. I think that the city council made no secret of their desire to really run purely a grant program. If they didn't have the state constitutional restraint, they would have more than likely run purely a grant program. So what they wanted to do, if they were going to run a loan program, was to have the capital be as cheap as possible. And really, with the 3% 10-year term, that enables that. So I think that was the basis behind the 3%. I did want to actually, if I could, I did want to make a point of clarity as well, just to clarify what the point Andy made. The repayment to the county, the principal would be fully repaid, not just 2.5%. So principal would be fully repaid. The interest is 3%. 2.5 of that 3 would come back to the county as well. So I just wanted to make sure that that was recognized, because that would mitigate the county's risk a bit. With all repaid loans, the principal would fully come back to the county.
And then what's your opinion on this issue of personal security for the loans.
Right. We've had experience in Mecklenburg administering the loan program where there is a personal guarantee. The city did not want to go that route. Again, I think they wanted to make this program as liberal as possible, if you will, in terms of the criteria, to get it as close to a grant program as it possibly could by law. Personal guarantees do make it a bit riskier for the entity that's funding it. There's no question about it. However, I would also think that considering what the purpose of this loan fund is, which is literally to save business from going out of business and potentially investing in the current and future sales tax base of the county, that may be worth the risk. And obviously that's a policy call. Like Andy said, some governments have instituted it, some governments haven't. But I do think that not doing away with the personal guarantee would make the program more inclusive in terms of the number of people that could apply and potentially be approved.
So, thank you, Kevin. That's very helpful input, and I really appreciate your knowledge and your opinions on this. So, circling back to the size issue, Andy, do you feel that the companies or businesses that have more than 25 employees, do they have other routes to go to get financial assistance, or is there really a gap? Because I want to understand that size situation a little better.
Yeah, absolutely. So the last that we checked last week, the NC Rapid Recovery Fund, and Kevin may actually know as a participant as well, was still accepting applications. So that essentially is, yep. So that is, go ahead, Kevin.
No, well, I'm sorry. I was just going to say, a few weeks ago, the state approved an additional $125 million for that fund. And as Andy said earlier, the Rapid Recovery Program will accept applications for companies with employees of more than 25 employees. So that provides an option. There are still PPP, Paycheck Protection Program, loans that there was a second tranche approved by the SBA several weeks ago. That may still be an option. There's a Google fund, I believe, that may be helpful for businesses in that category. So there are options.
Well, then my opinion would basically be, for what it's worth, that I think going with the One Durham and making the program as simple to understand and as usable to the business owners by using the lower interest rate, et cetera, makes sense. So that's where I would be on this, I think.
All right, well, thank you. Well, just in the interest of time, again, I'm really trying to look at the clock here. It's 9:35. I'm just going to jump in and say that this is a really urgent need right now. We cannot wait on this. Our small businesses already feel like we're behind the wheel on getting this money out the door. Already in July, and they have been struggling since March. So we really cannot afford to wait. We know that even us contributing $1 million is not going to be enough. That a $3 million fund is just not even going to be enough, and that I know there are efforts to go out and solicit private sector donations as well. So my suggestion is similar to what Commissioner Recco just said, is that we move forward right now, tonight, and we join with what the city is doing. We want to make this as easy and as complicated as possible. That is the whole idea, is to support our businesses. So you know, if we can get our other board members to concede to that, I would move that we try to move forward tonight with this. And I just want to hear quickly from Commissioner Carter. There she is. Hello. Go ahead.
I absolutely agree. And hearing Kevin weigh in on that really just solidified my opinion about it. The simplicity and even more so the equity. I agree. We want this to be as close to a grant as possible. And I'm ready to go for it the way it is. And, you know, Andy was great information for us, Andy. Really appreciate it. And I just feel really confident with Kevin Dick's leadership with this fund and the information he provided tonight. I'll make that motion if you don't want to, Madam Chair.
Go ahead.
And I'll second it, but if
Commissioner
here's
Carter,
the attorney wants.
Commissioner Carter, just before you make that motion, I think our chair meant uncomplicated as possible. She said as complicated as possible.
Oh, did I say that? Oh my gosh.
Yes, I think you might want to correct. You might want to correct that.
Yes. Yes, uncomplicated. We want to make it easy for people. They have enough complications as it is right now. Okay, so we have a motion from Commissioner Carter, a second from Commissioner Reckow, and we'll start with you, Commissioner Howerton.
Yes.
Commissioner Reckow.
Yes.
Commissioner Hill.
Yes.
Commissioner Carter.
Yes.
I'm a yes. So we're all in favor. Thank you so much, Kevin. Great to have you working with you again. And thank you, Andy, for all of your hard work on this. Really appreciate it. Okay, next item. Agenda, moving along here is, the Bulls update, Bulls initiative. Another tied to our COVID response. And so we've got Casey and Andy on this as well, right?
That is correct.
Okay, great.
All right, commissioners. So today we're going to be hearing an update on the Bulls initiative. We heard the first part of that conversation on June 1st. In the morning, we heard an update from a number of industry partners related to biotechnology, really looking at the biotechnology pathway. We heard from NC Biotech, Merck, Durham Tech. We heard from DPAC CTE. And so really it was to have a kind of foundational conversation about the biotech pathway in Durham County and essentially efforts that are currently underway to improve that pathway. In the afternoon, Casey presented representing the Bulls initiative. And really this was a proposal that was put out by Made in Durham, the Durham Chamber, and NC Biotech. And so we're going to kind of review the conversation on June 1st. And then talk about some funding opportunities as well. So some really good facts came out of the kind of presentation that we heard on June 1st when we think about the life science industry in Durham County. And so understanding that 37% of the state's life science companies are right here in Durham County. That's pretty powerful statistic. Approximately 15% of the jobs in Durham County are in the life sciences cluster. So over the last few months, last year and a half, Durham County has recruited 2,600 life science positions. 1,500 of those are in biopharma manufacturing. And we talked about kind of specifically what that is. And we also shared on June 1st the pathways, biopharma manufacturing pathways document that we produced that really outlines at every education level what is required to get a job in biopharma manufacturing. So really, the conversation that we put forward was, here are opportunities for residents to be able to access these positions, kind of really put it out there. So understanding, one, the opportunity there, but two, as we have already started to discuss tonight, there's some challenges, right? When we look at current capacity infrastructure, BioWork can really only accommodate 90 graduates a year, and that is the certificate program in Durham Tech. And so when we think about all the positions coming online and what current infrastructure can handle, there is a gap. And the last point that we'll make there is the life science industry is really well positioned to thrive. Post-COVID, in the new normal, it goes without saying the need for vaccines is obvious. So we really look at this as an essential part of Durham County's pandemic response. So what does the Bulls initiative say? Well, this is a very brief overview. So essentially, it is a programmatic and a capital plan that supports the life sciences workforce. It's public-private partnership to prep Durham residents for these life sciences careers, right? And so it identifies specific and actionable steps. So the first step is we understand that the current location of the BioWork program at the northern campus is a problem. It's a problem of equitable access. We don't have regular transportation that currently runs up there. Now, we did discuss one of the alternative strategies in place with the carpool vanpool option to address the short-term issues. But we understand there are larger issues at place. So that is relocating that BioWork program to a more equitable, accessible location is a top priority. Expanding instructional capacity, right? So we can have more than 90 graduates a year. The awareness campaign is essential. There is too significant a gap between Durham residents understanding the opportunities that are available here in Durham County and being able to pursue those careers. Looking at instituting a scholarship fund, and really, I think as Casey would note, and she's on the line with us, and Casey, feel free to jump in at any point here to further clarify and expand in these points, but really we're thinking about that in terms of a grant program to really offset an individual's needs, whether it's childcare, whatever it may be, transportation costs, so that they can fully engage in the BioWork training without that adversely impacting their opportunities otherwise. Looking at a concierge intermediary system to work with businesses to really identify their needs so that they're an essential part of the pipeline so everyone is engaged, right? Solving their workforce problems helps solve our workforce problems. It's definitely a mutually beneficial equation. The last point there is the need to construct an aseptic training facility, and we talked about that some in the agenda packet about what that provides. And really, so there currently is not an aseptic training facility in Durham County. There's a significant wait to be able to access those training facilities in other counties, and that's a significant piece of the workforce preparation component. So moving on, Casey, anything you want to add there in terms of the Bulls initiative? Anything we want to highlight that was left out?
No, you did a great job, Andy.
Well, thank you very much. Okay, so so concurrent with the conversation that we had on June 1st, you're well aware that as part of the CARES Act, there was a significant allotment of $1.5 billion to the Economic Development Administration. And So essentially that was for projects that respond to COVID-19 and for projects that have some job creation, workforce preparation component. Now, what makes this opportunity different? First and foremost, typically Durham County cannot access EDA, EEA funding. And that is because it is typically for more rural or distressed counties, but given the current COVID crisis, we meet the eligibility guidelines. The second point is that typically these awards are funded at a 50-50 local match. This tranche of money is funded at an 80 to 20% match. So essentially, you know, the local government in this case would only need to come up with 20% of the overall project fund. So that is, given that applications are very competitive and submitting an application is time sensitive, it is first come, first serve. So that is why we are here tonight, having this conversation only, 2 weeks after the initial conversation. One of the requirements is that funds must be available, committed, and unencumbered. And so with that, given that limited time crunch, coming to Durham County to provide that 20% match was really seen as the only realistic viable option in this small time window. So what we have been doing is working with Made in Durham, NC Biotechnology Center, and the technical assistance providers with EDA to really vet all of the components of the Bulls initiative to say what is most competitive and most realistic. And so if you'll think back to the Bulls initiative that we just referenced, the best application that we can put forward is for the equipment, only the equipment of the aseptic lab, but the aseptic lab equipment. So essentially that is $300,000 worth of cost. So given that, the county would need to fund $60,000 of the overall $300,000. So what this does, our $60,000 leverages $240,000 of federal funds to be able to pay for the equipment. So funds are only spent if the application is successful. This aligns with our overall goal of relocating BioWork by January, February. That concurs with the applications typically approved within 6 months. So it's a lot happening very quickly, but it times up very nicely. And the last point that I would want to make there is that, we are very committed in the Bulls team of making this venture and funding the Bulls initiative truly a public-private partnership. So while we were here tonight asking for county support, that is really given the limited time frame that we're working within, but we will be actively pursuing private funding as we are here with federal funds. If there are state funding opportunities, we understand this benefits us, but it benefits the companies as well. And so we really feel like everyone needs to literally be invested in the Bulls initiative. So just at the last slide here, to give you a sense of what those specific costs are, this is what that equipment names look and sound like. Just to give you a sense, so basically it's that grant cost is almost all for the equipment itself. We anticipate that shipping and installation costs will exceed $12,000, but that will at least get us started in covering those costs. And it kind of makes for a nice, neat, round number that way. So that concludes my remarks, but again, wanted to offer Casey an opportunity. Any points you want to drive home or further clarify?
The only thing that I would add, Andy, is that the funding actually allows us to do that first 2 bullet points on the Bulls initiative, and that is to actually relocate and expand the capacity of our BioWork program. while this looks like a typical, because it is a typical package that would actually buy the equipment necessary for that expansion, and particularly the modular aseptic pieces that we would be able to purchase that could get us started in the aseptic space. It really, that's the bigger picture here, is that we would be moving it from North Campus. We would be locating it somewhere in a more accessible location. That location analysis is being driven by Durham Tech and the Durham Chamber of Commerce. They're in the process of reviewing sites for that for the original concept of moving it to a more accessible location. It would also provide for us the equipment necessary once we find that location to actually double or triple our capacity of graduates as a result of it. So the 300,000 gets us the equipment, and it leverages our ability to move it and triple it, hopefully by early 2021.
Well, thank you so much, Casey. And again, just doing a time check, I'm hoping we're going to be done with this at 10 o'clock in 8 minutes. I want to say thank you to both of you. This is really exciting, really fantastic, and our board has been pushing this issue of, workforce development and getting things moving, and it is so exciting to see you all just get acting and moving on this so quickly. To me, this is a no-brainer to take advantage of this opportunity for the EDA grant, that we should move forward immediately, and then also go out, as you said, to our 37% of the market of life science and biopharma companies in RTP and Trayburn, ask to chip in and help us get the rest of the way with setting up this facility. And so, and this is how we're putting skin in the game ourselves. Comments from commissioners, very quickly, Commissioner Reckow.
Well, I'm supportive of the effort, but I have one question for Casey and Andy. The size of the aseptic facility that you had, I guess maybe on the last slide, was 16 foot by 12. Is that correct? I mean, how many students or people can you accommodate in that facility, and what is the estimate in terms of number of people served in a year's time frame in that facility?
So, Andy, can you go back to that slide so we can look at it? But Ellen, I am the wrong person to give the detailed explanation on this, but let me give the basic Casey version of this. These are modular clean rooms that will allow us to actually start the training. This is not the eventual larger aseptic space that we will be able to do. However, Durham Tech believes with the combination of new labs and new classrooms and the aseptic modular spaces in addition to that will allow us to be able to run multiple shifts of classes, so that we're not running the typical 3 days a week, Monday, Wednesday, Friday kind of thing, that we're actually running a shift during the day, running a shift at night, and running a shift on weekends. So what we're actually doing is running various classes. So we could run 3 classes through at a time, as opposed to right now, we do 1 in the classroom and then switch over to the lab, and then 1 in the classroom and switch over to the lab. So the modular will be actually built into that process to allow us to do that. And he just pulled it back up. Yeah, it's 16 by 12 in the outer space of it. But it allows us to do multiple. I can't tell you the number at a time, but I've been told that Durham Tech can work it in to allow us to meet the number of students that we would have going through the program.
Well, yeah, I would really like to understand that better. I'm fine with moving forward, but I guess I would challenge the whole team with the opportunities that we have in Durham. We just approved another life sciences facility earlier this evening. We have a tremendous need for training, and I noted that in Triangle Business Journal last week, Duke announced, Duke Medicine, that they are going to host a major research group in the park, and actually very close to the future Eli Lilly site, and start work on developing vaccines for flu and et cetera. Bottom line is, I think we've got to work on some private partners and some of these employers who are either already here and need more employees, and those that may be coming in the near future, to work with us and really make this a public-private partnership so that we can expand beyond the one 16 by 12 foot clean room as our start.
We 100% agree. The aseptic training space that we have designed and laid out is substantial. It will require time for us to be able to put that together, and so we saw this as an opportunity to really start creating the funnel of students that would be able to get interested in the program and actually be ready for when we have that aseptic space. We actually did talk today at our Bulls meeting. We meet weekly on all of these projects on what that strategy was going to be to work with our private sector employers. The NC Biotech and the Chamber will be heading that up. And we started down the path of how we will engage them in both the design on the one hand and on the funding on the other hand. So I believe we're starting down that path now, Ellen. We were trying to get some clarity on what it is we would actually be having conversations with them about to engage them in the conversation, number one, and then number two, exactly what our ask would be when we brought them to the table. And I think the group feels that we're far enough along to start those conversations. So I agree with you absolutely 100% there. We 100% believe that our training needs are significantly larger than what this is showing, but we believe this was first good step.
All right, thank you.
Thank you, Casey. Just want to give other commissioners a quick chance to comments, questions.
Madam Chair, this is Commissioner Howerton. I just wanted to say that I'm excited about this project. It is right in line with my what we talked about at our budget retreat. That seems like it's been forever ago. So thank you both for the work that you're doing and the inspiration that this is bringing to our community. I'm looking forward to it. So I support it 100%.
Thank you, Commissioner.
Anybody else?
I would like to say just something briefly.
Carter.
Well, I just think this is absolutely fantastic. And I only wish that we had thought about linking our incentive in some ways to having the corporations be a funding partner in Bulls. Maybe it was something we can think about going forward if we are in that position again. But anyway.
Maybe next time, since I'm sure there's more coming.
Okay. Let's
well,
go with that.
Andy, we can add that to our scorecard sheet, okay? We can ask that participating in the Bulls initiative be part of that screening tool, okay?
Yeah, absolutely. We can do that.
Okay.
Yeah, I move approval of the $60,000 for this purpose.
Second.
Okay, moved by Commissioner Carter. I think that was seconded by Commissioner Howerton. Is that correct?
Yes.
Okay. Okay, and we'll take a voice vote starting with Commissioner Carter.
Aye.
Commissioner Hill,
Aye.
Commissioner Reckow,
Aye.
Commissioner Howerton,
Aye.
and I'm an aye. All right, good. 10:01. Way to go. Thanks, Paul.
Thank you, guys.
Okay.
Thank you very much.
Thank you so much. Really excited. And that's due by the end of the month, right?
No, it's due, yeah, we're trying to get it in by the end of the month. It's
Okay.
technically not a due date.
All right.
but-
Good. Keep us posted. And let us know how we can support it with a letter or whatever you need of support. Okay. Next is the CIP. I hope will take like 15 minutes or not. So, who's helping us with these?
Yes, ma'am. Commissioner, how are you doing? Hope everyone's doing well. This is rather late part of the evening. Hopefully we can get through this fairly quickly. I'm going to try to switch here real quick. I'm not quite sure what the commissioners want to review related to the CIP. We had a review session on that the board wanted answered, and I collected the information to answer those questions. One was on the youth home, and one was on the Admin 1 building, and another question was related to spending related to the North Carolina Museum of Life and Science. And I have answers to those questions. So it's up to the board's prerogative. I can review the CIP again, if you'd like, quickly, or we can focus on the questions and answers to those questions.
Yeah, we don't need to do the presentation. Thank you, Keith. You did a great. Your presentation is great, but we've all seen it, and you don't need to go through it again. So let's go right to any questions, follow-up questions from commissioners.
Well, I would first thank the staff for answering. I guess most of those questions were generated by me at a recent meeting, and I appreciate the answers. As I read it, the answers, I thought about a few things. First of all, on Admin 1, we have obviously had the budget go up. I would encourage the staff still. I do think they make a compelling case for doing floors 2 and 3 because of I didn't realize that the systems, the heating and cooling and whatever wouldn't be addressed. It just seemed like when you're doing the whole building, generally, the other floors, it would have been addressed, but I guess it's not addressed to those individual floors. So I think we're going to have to do that. But I would hope that you can look at trimming of costs and maybe get a good bid associated with the downturn we're experiencing in the economy to help us. I also think, given COVID, looking at trying to make the building as healthy as possible, which I think was mentioned somewhere in there, in terms of the air circulation, et cetera, because I know in the past it hasn't been a very healthy building. I do want to move also to the Museum of Life and Science, because I thought the answers to those questions were kind of telling. I am concerned that the not so much the $7 million for the first bond, those projects all seem important. Some of them are really maintenance type issues and probably need to be done. But in the second tranche for the 2026 bond, I'm concerned overall that the museum is not perhaps as aggressive as they need to be in terms of raising private funds. Some of the projects have zeros next to them in terms of fundraising. And the one that stood out, and I didn't understand why they wouldn't have given their discussion of the project, is the last one, Audacity Labs. They have fundraising opportunities zero, but they talk about partnering on a fairly innovative project for teens with Duke, with American Tobacco, and another private entity. And I thought, why wouldn't you try to raise money for what seemed like a fairly innovative project? So I don't know whether the board would have any appetite for circling back to the museum and challenging them to look at a greater public-private partnership. They certainly have a lot of warning, given that this is for projects on a bond in 2026. But I think we should challenge them to step it up and raise more money. And when you think of all these companies coming to Durham that are in the life sciences arena, you would think a few of them might be candidates to get involved in supporting the museum. So I do think that that is something that we should urge. And lastly, I would say that going back to an issue I raised earlier about the Northern Durham Tech campus, again, I wonder about the very large still, I know it's been reduced in cost, project for the public safety facility that's in our CIP, and wonder again about reusing the space at the Northern Durham campus and downscaling that public safety project to maybe just being the storage that they need for various equipment as opposed to all the classrooms, etc. So those are some of my comments.
Thank you, Commissioner Reckow. Any other follow-up comments from CIP? Okay. Anyone? Well, I would just say I agree with what Commissioner Reckow has said. I'm really important that you, with COVID, looking at air circulation with the admin one building, and I think whatever, maybe we even are having cost savings because of the staging, that the building's mostly been empty, and whether that's accelerating getting the work done and saving us money. I'd be curious to hear, Perry, if that's been happening. Is the project, are we just even saving any money at this point? Could you let us know if you're seeing anything like that happening?
Commissioners, quite honestly, we have not seen savings as of yet. You know, the contractors are able to, I guess, accelerate or move a little faster through the construction process, you know, with the building being, with parts of the building, being unoccupied. But again, we'd actually have to take advantage of another bid opportunity to actually see where these cost savings may come in. You know, to kind of piggyback on what you guys said about the need to address the fresh air intake, particularly in light of the COVID-19 pandemic, we had DTW, the architect, and Robert is actually on the call for this purpose. It's to sort of talk through, you know, some options that we could certainly look at, you know, as part of furthering the renovation. And so I'll let Robert talk through those if he's able to pipe in.
Good evening.
Uh-oh. Robert, you might need to call in instead. You see why I'm holding my phone up, because the same thing happened to me. You're on mute there, Robert. So you might want to call in, and we'll wait for you. We'll go back to that, and I guess just related to what the issue that Commissioner Reckow raised, I totally agree with you, Commissioner Reckow, that we really need to see the museum stepping up. They should not be just depending on the county for all of their capital projects. And I don't know if James is a member of that board, and maybe he can give us a little insight, but I do think we need to send a strong message to them about that. And Commissioner Hill, I don't know if you had any insight into that, what's happening there. So there's some changes going on.
Well, there are that I don't want to discuss.
Okay.
Yeah. But I will say this, a lot of the fundraising that they generally do have has been impacted by COVID. And a lot of the events, the history and study of beer, the science of genomics, and some of the conversations that they've had about that, you just can't have it now. And I think they've done a decent job, but just right now, with the social distancing, it's just held them back.
Right. Well, that's understandable. But hopefully we'll be back on track soon, and at some point, and I think we should definitely challenge them. Commissioner Carter echo that, to try to challenge them to do some more capital fundraising. Okay, I think Robert, are you back with us? Robert? I saw him flash in for a minute. There you are.
Robert, are you calling in also? Are you on two different lines? If I unmute your computer, that's what gives the feedback noise.
Or I could just.
So Robert, if you try to just call in and don't use the sound on your computer, that might work. Try that. So we'll still wait for Robert, but I just want to keep things moving. I'm wondering if we need to actually approve this, because it's different than it was, before, and with especially with adding the school funding and things like that. I guess I was under the impression at our February 4th meeting, from that discussion, that we would need to approve these revisions. So, action tonight?
Commissioner Jacobs, approval is at the board's desire. It doesn't fundamentally change the CIP. This is a changed CIP plan. If you want to approve it, you can formally approve it, and I can reprint it out. But remember, each capital project is approved by the board when that project comes up in front of you all. So approving the plan is like improving a playbook of sorts. When you actually create a project, you approve that project one at a time. So yes, you can, if the board feels like this is worth doing, you can approve this revised CIP, and I can work towards printing one out. We're going to turn around this fall and start the whole revised CIP process over. That will go from 2022 to 2031. So even this revised CIP that you approve will only exist for 6 to 8 months before I present you with a new one. So I don't quite know how to definitively answer your question, other than the board can choose to make a strong statement, if you want, saying you support change in schools, but it's already in there, and you will have a chance to approve school projects and the Admin 1 building project and museum projects and GeoBond projects for 2022 GeoBond at each point in time when those projects come up.
Okay, well, let me just get a quick read on what other board members want to do on this.
Madam Chair, I would be willing to go ahead and approve. I would like us, though, to send a message to the museum that we understand fundraising is difficult right now, but that we hope that they will step it up in the future, particularly looking at the projects planned for 2026.
Okay, so then we'll take a formal vote. Keith, instead of having to print something out, could it just be, you know, on our website so we're not wasting paper?
Absolutely, yes, ma'am. I would much prefer that. We can do that.
We just have that digitally updated, and you don't have to print anything out, but we will formally approve. So a motion by, is that a motion, Commissioner Reckow, with the added action item?
Yes.
Okay.
Second.
Okay, seconded by Commissioner Carter, and we'll do a voice vote. Commissioner Howerton?
Yes.
Commissioner Reckow?
Yes.
Commissioner Hill?
Yes.
Commissioner Carter?
Yes.
And I'm a yes. Okay, good. 10:17. 2 minutes off. All right. We're next on to the, and thank you, Keith, for being patient with us. Oh, wait, we forgot Robert Sotolongo. Robert.
Hey.
Hey, Robert, are you there?
I am here. Can you hear me?
Hey, you're here. Tell us about what you're doing with the fresh air.
So what we've done so far, you know, we're in phase 1, which is the ground and first floor, but we have replaced all the fresh air ductwork in the vertical system of the building, which when we uncovered it, found it not to be in great shape. So with what you've approved tonight, we can finish out the second and third floors with all new mechanical that would bring in conditioned fresh air, which is what you want, and bring the whole building up to that standard.
So Robert, I know you guys were in the process of pricing out, you know, phases 3 through 5, and I think you had said earlier today that it would cost roughly an additional $1.1 million to bring the mechanical system up to speed on the second and third floors. Is that still accurate?
Yes, that would be true. So that if we leave the second and third floors and don't do anything else, just replace the mechanical units, we're at 1.1 million. For the 2.7 that you showed in the CIP, we can do that. We can also replace all the carpeting, paint, replace the lighting, and provide new furniture. So the whole building would be up to one standard of finish. So it would match what we've done on floors 1, 2, and 4 and 4M.
Yeah, and so what I would recommend, based on the fact that the commissioners have already taken action on this, I think we'll set aside another time to go over specifically what each option is associated with phases 3 through 5. We'll just table this to a future board meeting, or in the essence of everyone's time, because the phases 3 through 5 is actually going to cost us additional money on top of what we already have allocated for the project. So I just want to make sure that's clear. So let's table this discussion for a later date.
Okay, thank you, Perry. I know you'll bring us back after you get some other bids on things. You'll bring it back to us. Thank you so much, and thank you, Robert.
Okay, thank you.
Sorry about that. Thank you for being with us tonight.
No
Okay,
problem.
next we have a consideration of proposals for addressing our housing the homeless during COVID. And Drew? Drew Cummings, Chief of Staff.
Can you hear me, Commissioners?
Yeah, we can hear you. Thank you.
All right. Good. Well, good evening, Commissioners. Drew Cummings, Chief of Staff. As you know, the contract with the Marriott RTP ends on July 8th. That was a very important action for the Commissioners to have taken in light of the pandemic and our ongoing commitment to do right by our homeless population. But as you all know, that was a very expensive commitment. I want to assure the Commissioners that leading up to the initiation of that contract and in the 2.5 months since, both the very small homeless support task force in the Emergency Operations Center and a much larger set of medical and nonprofit organizations and community members have been working tirelessly to find ways to diminish the burden that this pandemic has placed on our most vulnerable populations, including the homeless. And we do appreciate all of the advocacy and contributions that those other individuals and organizations have made to this work. Knowing that, and knowing that the hotel contract ends July 8th, the county put out a broad RFP about 10 days ago for some additional housing-related assistance. The RFP was broad in the sense that we continue to have a variety of short and long-term challenges as we seek to house multiple homeless and housing-challenged individuals. In particular, I want to note, reiterate for most of you, that as we reoccupy urban ministries downtown, they will only be able to house about half of their normal population in that congregate setting. In addition to trying to meet short and long-term homeless housing needs, we are interested in shifting towards making expenditures, if we can, that will help us build equity and long-term capacity in our homeless system, as opposed to just paying for sort of hotel rooms and tomorrow the money is all gone. Proposals for that RFP that the county had put out were due last Thursday. We received 3 proposals, and these were reviewed by a 4-person panel on Friday. And I am happy to report that we do have some interesting and reasonable options to pursue. I cannot mention specific bidders at this time, but I can report that we have a more flexible hotel option that could help us cover some short-term needs, but also 2 interesting bids from community-based organizations operating within our homeless continuum of care. Both of those proposals have a number of loose ends that we need to work through, but both of them also represent opportunities to invest in longer-term and permanent capacity within our homeless system, and also to invest in the potentially to invest in the capacity of a minority-run nonprofit partner in this arena. Some of this capacity that we would be developing can assist us with our current homeless needs, but I also wanted to mention that I think it will give us some additional socially distanced capacity for other weather-related events. You all know that sometimes in winter we have what we call white flag nights, where we're trying to bring everybody who's unsheltered inside, and often lack capacity to do that very well. And also want to remind everyone that we're headed into hurricane season, and that our normal procedure when we need to open up a weather-related shelter is to pack people into a gymnasium or another big space, and that will no longer be a very good option for us, so that we need to have some contingency plans for that as well. So, as I mentioned, we do have some options. They do need more work, but as you know, there is urgency to these questions, and I think it's fair to say that we may have both the need and the ability to move forward with contracts prior to July 13th. So at the moment, tonight, staff would like to recommend that the board authorize staff to engage in negotiations with any and all of the bidders to get the additional answers that we need. And not to, I know there had been some conversation about possibly authorizing the execution of contracts that might be developed as a result of that. I don't think we're really at a point where we want to do that, but I do want to raise the possibility that there might be a need for a special meeting or a conversation between now and July 13th to put some of these new tools and investments in place to get things moving so that we're well positioned to continue the appropriate housing of this population. So with that, I think I'll stop and see if there are questions that I can answer about the proposals or about the work of the Homeless Support Task Force in general.
Well, thank you, Drew, and I just want to acknowledge you have been such a leader this whole time, since March, out of the EOC, and just leading you and Colin Davis on the city side on all of these efforts around homelessness and housing, and thank you, thank you, thank you. And this is an urgent need because as you said, our contract ends with the Marriott on July 8th, and we know that there's at least going to be 25 to 50 people who we do not have a place for them to go. Plus, we have a waiting list anyway, as well from our coordinated intake. So you're asking us at this point just to authorize you and staff to just continue working on, hammering out details of possible contracts. And then you would bring those contract options back to us July 13th. Is that correct?
Correct. Or if the timing were sensitive enough, possibly at an earlier special meeting. But yes, that's what we're asking.
So we would have a special meeting if necessary, which is what we did last time to approve the Marriott contract. We had a special meeting. Okay. And I just want to say I really support the idea of us making some more long-term investments when we think about that we spent more than $1.7 million on a hotel, and we just, it was just a temporary fix, and we have nothing to show for it. Wouldn't it have been nice if we were spending $1.7 million buying a hotel? So I look forward to us making some more long-term investments in the issues that we face. Any other commissioners?
I have one question.
Yes.
Have we made any decisions about people that test positive? Facility for individuals that test positive?
We're still working hard on that, and I think I can mention that one of the proposals does include some capacity for housing COVID-positive homeless individuals, which is important, but has proven to be one of the thorniest and most difficult questions to answer here in Durham. We have found hotels who were willing to, as some other places have done, who have larger COVID-positive populations, right, to rent us a whole hotel. But we've just had a small trickle of COVID-positive homeless individuals, and the idea of buying or leasing, in essence, an entire hotel for that contingency has not struck staff as sort of the most appropriate way to potentially meet that need. But we do hope that at least one of the proposals we received would result in our having some capacity to house COVID-positive individuals. So that's hopeful, I would say.
Thank you.
Anybody else? So, do you actually need a vote from us on this, Drew, or just?
I think that would be good. Yeah.
Okay, a vote.
To authorize staff to enter into negotiations.
Okay. Do I have a motion from the board?
So moved.
Second.
Moved by Commissioner Howerton, seconded by Commissioner Reckow. And we will vote starting with Commissioner Carter,
Yes.
Commissioner Hill,
Yes.
Commissioner Reckow,
Yes.
Commissioner Howerton.
Yes.
And I'm a yes, so that's a unanimous vote. Thank you, Drew. Okay.
Thank you so much.
10:30. All right. We are going to, I think, only be able to briefly discuss tonight the discussion on the joint Durham Community Safety and Wellness Task Force. First, I want to acknowledge that we've gotten lots and lots of emails today from residents about this, and I know from conversations with commissioners that there are a majority of commissioners who do support us moving forward with this, but I know we do not have a lot of time tonight, and that there also is the concern of wanting to get staff to give some feedback. We did get some recommendations from Gudrun Parmer, our director of our Criminal Justice Resource Center, but there's also a desire to get feedback from other departments that are already working very hard on issues related to what is in the bylaws. So I know we need time for that with staff, and I just wanted to also hear quickly from other commissioners about what are other things that we need to do to prepare for a longer discussion at our July 13th meeting. I'd love to hear other suggestions and feedback about the task force and the bylaws. Anybody? Any comments?
Yeah, Madam Chair,
Yes, Mr. Carter.
I'm glad your conversations lead you to believe that a majority of us are in favor of this, because it's clear the community wants it, and the timing is right, and I'm glad that we're going to be moving as quickly as possible to join the city. I do think that the school board is also going to be discussing this maybe on the 25th. I guess that's this Thursday, and I know that they are interested in having the same number of appointed spots on the task force. So I know that's one change we might want to consider.
Absolutely. I had jotted that down. That only makes sense. And yeah.
I thought Gudrun suggested
they worked for about 18 months, and they came back with a great report and great recommendations. So I think one of my questions, again, for further discussion would be, staff support. There needs to be, adequate staff support for this. And, we have a lot of staff and departments that really work directly on many programs and services that are related to these issues. And so we definitely want them to be involved. Any other thoughts at this point?
Well, Madam Chair, I have some, I'm okay with moving forward, but I'm not sure I want to move forward based on the current bylaws. I do think we need to take a deep breath and get this right. I worry that, well, first of all, this is the first time we've ever discussed this. And the thing is, the bylaws have been drafted. I feel that there should have been a discussion at a joint city-county committee meeting. I can't remember a major initiative with the city where we haven't discussed it at city-county committee. And given that this was being actively discussed and the council approved bylaws back in March, we were having a city-county committee meeting around that time. I guess I just don't understand why it was that we haven't had an opportunity to be more of an equal player. And, you know, this is some degree about equity, and the county, in my opinion, is not being treated equally here. I also feel that there are incredible initiatives that are in place, actively being worked on. As Gudrun pointed out, we are leaders in so many areas within criminal justice. And the focus seems to be, or the examples in the bylaws, which I think is totally inappropriate, are 5 areas, some of which are to some degree pet peeves of certain people, such as, well, I won't give it specific examples, but, you know, it mentions looking at drug court, but we have a number of other specialty courts, the mental health court, for example. We have an award-winning program that our Stepping Up initiative has been nationally recognized. We have pretrial services. Amazingly, we have fewer people in the jail now than when I was elected 32 years ago, and we have almost double the population. I have been now where we are touted as a leader. We have the best CJRC in the entire state. And all I see is a focus, it seems, on what we're doing wrong, not what we're doing right. And both need to be discussed. And so I'm just saying, I would like an opportunity to see this reframed a bit so that it's not.
Yeah, no, I just want to say, absolutely, that is the intent. I spoke to Mayor Pro Tem last week, and she said, absolutely. I mean, if we have suggestions for revisions to the bylaws, that the City Council is totally open to that, and it sounds like the school board is going to do that as well. And, you know, it may be that we need to have a convening of all 3 groups. We did have a joint meeting back in May, a historic meeting, and we may need to have one related to just discussing this, and then give city, county, and DPS staff a chance to even present about a lot of the programs and services that we're already doing, because frankly, a lot of people don't really know what's happening, as you acknowledge, within county government. And so it will be a great opportunity to share information and help to further inform the process, because we want this is really important discussion, and we want it to be, we want it to be a great process. So yeah, that's absolutely what we can talk about more at our July 13th meeting. So I would just encourage everyone to bring your suggestions and ideas, and also for staff to have time to really look at this and to bring back some of their suggestions as well. And then we can talk about next steps and working with the City Council and Durham Public Schools on moving this forward.
And we can't forget our paramedicine program.
Right, exactly.
Commissioner Jacobs.
Just time. I'm sorry, I just heard. Yes,
yeah.
Go ahead.
Sheriff Burkhead.
Yes, go ahead, Sheriff Burkhead.
I'd simply like to point out the obvious, that we're talking about public safety, and there's no public safety representation. Just keep that in mind.
Thank you.
I was going to bring that up in July, Sheriff Burkhead.
Okay, thank you. It sounds like you're interested in participating. Thank you. Okay. So
But we do have a great sheriff here, and we have a great police chief, and I think that they should have some voice at the table. That would only seem to make sense.
Right, and just to remember too, though, that the like the pre-K task force, it would be, you know, community representatives who are the members of the task force. So, you know, none of us would be a part of it, other than appointing people to it. So, okay, so we are going to continue this at our July 13th meeting, and we may have to look at how we can give appropriate time to this, because we need adequate time to discuss it, and now it's 11:15. And so the next item is very quickly the letter that Deborah, thank you so much for drafting for us.
You're welcome. Yes, of course.
Yes. Thank you so much. You're so awesome. You just did that in one day, both of these letters, to follow up on the fact that we have not gotten our fair share of CARES Act funding. So is there any discussion from the board? Is everyone comfortable with the letters that Deborah has drafted for us?
Sure.
I did not see them, Madam Chair.
Okay. Do you want to take a quick look at, they're in iLegislate?
Then I just...
You want to take a quick look? And why don't we move ahead to the board and commission appointments, and people can look at the letters at that point while we're waiting as well. Although I guess you already know, Attorney Sava, you probably already know what you're going to be telling us. So there's not that typical waiting time where you.
That is correct. Can you all hear me?
Yes, we can hear you.
Okay, I've had some volume difficulties this evening. So your first appointment, and honestly, I think this is the largest number of appointments to boards and commissions I've seen thus far. You got about 15 boards and commissions on this agenda. For the Alliance Board of Directors, you can select one person, and you've selected David Curo. For the Bicycle and Pedestrian Advisory Committee, you can select 3 individuals. You've selected Cecilia Gonzalez, Michael Moorman, and Edward Rizzuto. For the Citizen Advisory Committee, you can select one person, and you've selected Kiarash Ramanian. There were some issues with the Criminal Justice Advisory Committee, so Monica indicates that we're going to re-advertise that. I'll go on to the Durham County Women's Commission. You could select 8 individuals, and there's a bit of an issue with that one. 7 of the people got at least 3 votes. So you've selected 7, but there's one that I think will have to come back. So the successful candidates are Patty Black, Melissa Tedder, Katie Ann Walsh, Sarah Bowser, Cynthia Bland, Joy Spencer, and Sherry Ann Welch. For the Durham Open Space and Trails Committee, you can select 2 individuals. You've selected Bedina Minor and Mark Penny. For the Durham Planning Commission, you could select 2 individuals. You've selected Austin Amendolia and Jessalee Landfried. For the Durham Sports Commission, you can select one person. You selected Jonathan Leach. For the Durham Technical Community College, there's one vacancy. You can select one person. You selected Jeff Durham. For the Durham Workplace Development Board, you can select 2 individuals. you've selected Raja Shoemake and Rhonda Stevens. For the Environmental Affairs Board, you can select one person. You selected Matt Hooper. For the Historic Preservation Commission, you can select one person. You selected Tom Krieger. For the Homeless Services Advisory Committee, you can select one person. You've selected Angela Holmes. For the Juvenile Crime Prevention Council, you can select 3 individuals. You've selected Kelvin Allen, Angela Nunn, and Shannon Teamer. For the Nursing Home Committee Advisory Committee, you selected one person, and that's Jacqueline Guyking. That concludes your votes.
Thank you, Attorney Fowler. I did have one question, Monica. The Criminal Justice Advisory Committee, I know there was an issue with the business, the person related to, appointment related to business representative, but I thought that we were okay with the other 2, because there was also 2 appointments to citizen. And so were we not okay to move forward with that, those appointments?
The citizen appointments were fine. It is the business community appointment that we would have to re-advertise for, but I'm not exactly sure what the number was with regards to the voting for the citizen position.
Okay. Do you know, Attorney Fowler, were we okay with that? Because I think that we actually that got removed, the other position. So I think we should be okay. No?
Well, to be perfectly honest with you, and I can go back and check now, but when the meeting started, it was my understanding that we were going to re-advertise that one. So I really didn't take a good close look at that particular committee. I just assumed we were going to re-advertise it.
Yeah, that
we can take a look at it.
Actually, we're the other positions were okay that were on there. Do you want to? Is it too late for you to take a look at it now? We're not going to actually re-advertise those.
Chair Jacobs, if I could add, I did just glance over them, and it does look like there is a mixed vote on one of those citizen appointments.
Okay, all right. Okay, so it sounds like we just need to revisit that one.
Okay.
Yes, ma'am.
Okay. All right, and then we thank you so much. That was a lot of positions, a lot of appointments. Thank you. And
you got 11 minutes before
letters.
11 o'clock.
Okay, we're getting close to 11 here. Is everybody okay with the letters? We just need to approve those.
Move approval.
Do I have a second?
Second.
Okay, let's take a voice vote. Commissioner Howerton.
Came up, I'll talk slightly.
We're just approving the letters, Commissioner Howerton, that Deborah wrote.
We're doing what?
We're approving the letters that Deborah wrote.
Oh, I thought you was making a motion to adjourn.
No. We have a closed session. So we've got Commissioner Breckow, I think, moved, and Commissioner Carter seconded on the letters.
Yes.
Okay, Commissioner Breckow?
Yes.
Commissioner Hill?
Yes.
Commissioner Carter?
Yes.
And I'm yes. Okay, we're unanimously approve those. Now, what do we need to do, Monica, if we're going to go into closed session right now? Are we going to be okay with the meeting? We can just come back in to adjourn, right?
Well, because will the meeting be over within 9 minutes? If not, I would have to defer to Attorney Styler with regards to voting to extend the meeting.
If it's not gonna be over in 9 minutes, you still would extend the time.
Okay, so we need to vote to extend the time. Okay.
Yeah, I will go ahead and do it now.
Madam Chair, I move that we extend the meeting to 11:30.
Okay.
Second.
Second.
By Commissioner Redcast, seconded by Commissioner Carter. And we'll vote starting with you, Commissioner Carter.
Yes.
Hill?
Yes.
Redcow?
Yes.
Howerton?
Yes.
And I'm a yes. So, okay, we unanimously extended to 11:30. And so now I would entertain a motion that the board is requested to adjourn into closed session to consult with an attorney employed or retained by the public body in order to preserve the attorney-private privilege between the attorney and the public body, which privilege is hereby acknowledged pursuant to General Statute 143, 318.11A3.
So moved.
Second.
Moved by Commissioner Redcast, seconded by Commissioner Carter. All those voting aye. Commissioner Howerton?
Yes.
Commissioner Redcast?
Yes.
Commissioner Hill?
Yes.
Commissioner Carter?
Yes.
I'm a yes. So we're unanimously adjourned and to close session, and just follow the link that Monica has provided to us. Thank you. And thank you, everyone else. Have a good evening. Thank you all.
You too.
All right, moved by Commissioner Carter, seconded by Commissioner Hill, and to adjourn and a vote, Commissioner Hill,
Yes.
Commissioner Carter,
Yes?
Commissioner Rakow.
No, just you, that's fine. You're one.
I'm a yes.
That's right.
Yeah,
Okay,
that's,
we are,
that's all we need.
we're unanimously adjourned. All right, thank
night.
you, everyone.
Thanks, everybody. Good night.
Night.
Good night.
Okay, night.